A warm welcome to one and all gathered here for one national level online conference on innovations in pharmaceutical and biological sciences in association with Kalinga Biomedical Research Institution and Training Establishment, Odisha. On behalf of Sydus Publishing India, I welcome all of you for today's first day national level online conference. We'll begin the session with the Saraswati Vandana. I invite all of you, your attention to the Saraswati Vandana. Thank you.
Inauguration.
I welcome all of you for today's inaugural ceremony. I would like to welcome and invite Dr. Karthikeyan, editor, Sydus Publishing India, for the inauguration ceremony. Welcome, sir. Please inaugurate the session, sir.
Ideal. Sound കാണുന്നേ Sir, video audio
I welcome all of you once again to our national level online conference on innovation in pharmaceutical and biological medicine. I would like to invite Karthikeyan sir to give the welcome address. Speaking about Karthikeyan sir, Dr. Karthikeyan, he is the founder and editor of Sydus Publishing Kerala, India. He is associate professor at the Department of Pharmacology, Ashok Ramana College of Pharmacy, Maharashtra. He has completed his PhD from Shingani University, Rajasthan. His M.Pharm in Pharmacology from SRM University, Chennai, Tamil Nadu. B.Pharm from Tamil Nadu, Dr. MGR Medical University, Chennai. D.Pharm from the Directorate of Medical Education, Chennai, Tamil Nadu. And DSM from the Siddha Research Institute, Chennai, Tamil Nadu. He has more than 12 years of teaching experience, and his area of interest in the drug discovery from natural product for the cardiac diseases, inflammatory diseases, and cancer. He served as a joint secretary for the Pharmaceutical and Biological Society. He is the member of Indian Hospital Pharmacists Association, World Association of Medical Editors, USA, Asian Pacific Association of Medical Editors, and Science Advisory Board. He has worked as editor for various national and international journals. He has published more than 49 research and review articles in national and international journals. He has published his book chapter, and also he has 2 books in his credit. He has presented papers in various national and international conferences. Recently, he secured 3rd position in the e-poster presentation in the online international conference organized by Oriental University, Madhya Pradesh. He has participated as a hands-on training program in pharmacology, NIR and NIB and St. John's Medical College, Manipal University. He received the South Indian ASFD Best Faculty Circuit Award in 2018. He organized a workshop with the grant of rupees 1 lakh from ICMR and Kerala State Technical Body. With this brief introduction, let me call upon Sir for the welcome address. Sir, please.
Thank you so much for your introduction, madam. So today I am just taking over the charge of the topic. Welcome of all. So this is my. I thank each and every one of you with us today on behalf of Sydus Publishing India. It is my pleasure to invite you all and industrial professionals, pharmacy students, academicians, and research scholars, scientists of pharmaceutical and biological sciences, life sciences, medical and health sciences from various states in India and also other countries, those to attend that of a national level online, that is conference on innovation in pharmaceutical and biological sciences, 29th and 30th of August 2020. We are very pleased to welcome those who have been with us in the online platform. It's my immense pleasure to welcome you all for the opening of the national level online conference organized by the Sydus Publishing India in association with Kalinga Biomedical Research Institute and Training Establishment, Odisha, on the theme of recent advancement in pharmaceutical and biological sciences. The aim of this organizing this conference is to provide the aim of the organizing the online conference is provide a forum for the national biological and pharmaceutical professional all over the country by providing a platform sharing the latest innovation in pharmaceutical and biological sciences, as well as know about that of a current COVID pandemic situation. We are also looking for the development in the vaccines as well as the medicines. I hope this platform will enrich that of a knowledge to coming that of new ideas for the challenging that of your emerging challenges. It's my honor and privilege to welcome Dr. Subhendra Shekhar Mishra, the coordinator and that of a director of Kalinga Biomedical Research Institute and Training Establishment, Odisha. It's my pleasure to welcome Dr. Deepa, today's speaker and coordinator of Assistant Professor, Ashokramani College of Pharmacy. And I also welcome that I extend my warm welcome to today's speaker and the post evaluator, the presenter, Dr. Balasubramaniam sir, Professor and Head Department of Pharmacology, Al-Shifa College of Pharmacy, Perindalmanna, Malappuram, Kerala. And it's also welcome that of you, the gracious, inclusive welcome to Dr. R. Nirmala Devi, Assistant Professor, Department of Biotechnology, Avinash Lingam, Institute of Home Science, and that of your higher education and home bio, that is Coimbatore, Tamil Nadu. It's my privilege to express my warm welcome to that of your speaker, Karna Reddy from that of your pharma industry, India. It's my pleasure to opportunity to welcome that of your Shanmugha Ratnam, Assistant Professor. He's working in that of your university, Anna University, Trichy, Tamil Nadu. Is being as a poster evaluator today. And today online commencement is having about 659 registrations, participants from various states of India and also the participants from various other countries by participating different countries such as Malaysia, Kingdom of Bahrain, Ethiopia, Oman, and Nigeria. On behalf of that of Sydus Publishing and myself, I would like to take this opportunity to welcome all the participants once again. I would like to thank and also acknowledge all the participants and support team who have been working hard to bring out that of your online conference truly successful on like it. I request all the delegates and participants to take part in that of your activities. We have come up with that of your forthcoming, this coming scientific session as well as that of your e-poster sessions today. In the closing, I would like to take all this opportunity. This conference will bring out with a fruitful day, and I'll also once again welcome all the participants for today. Thank you one and all.
Can I start? So it is not audible.
Just a minute, sir. Just a minute. Yes, just.
I invite Dr. Karthikeyan to give a brief introduction to today's speaker, Dr. Subramanian sir. Sir, please.
So the today's speaker, Dr. T. Balasubramaniam, is working as a professor and head Department of Pharmacology, Al Shifa College of Pharmacy, Kerala. He has completed his PhD and M.Pharm from Jodhpur University, Kolkata, West Bengal. B.Pharm from JSS College of Pharmacy, Ooty. BSc Zoology from NGM College of Arts and Science, Pollachi, Tamil Nadu. He is worked as a professor at Bharati College of Pharmacy, Mandya, Karnataka. He has the approved gate for the PhD in Kerala University of Health Science and Shingan University, Rajasthan. He has contributed more than 41 papers in reputed journals and lot many paper presentation in various conferences. He has guided more than 30 UG and as well as PG students. He has guided 3 PhD students, those who have completed the PhD, and he has also authored 2 books and 1 book chapter. He is also a reviewer in many reputed journals. His research interest is in developing of anti-diabetic drugs from medicinal plants. He is also involved in organizing and coordinating the conference and seminars and workshop sponsored by ACT PCI funded seminars. And also he has received around 15 lakhs grants from ACT, MODROPS as well as seminar grants. With this brief introduction, I would like to invite Dr. Balasubramaniam for the today's scientific session topic on polycystic ovarian cancer for the risk factor for the diabetes mellitus. So that I welcome you, sir. Thank you, sir. You can proceed for that.
Thank you, Dr. Karthikeyan.
Sir, you can share this slide now. Yeah. Sir, maximum that slideshow, you can make it slideshow mode, sir. Sir, slideshow mode. Slideshow. So maximize, sir, maximize actually. Yeah, okay, sir, we can proceed. So first slide you can show, then you can proceed. Yeah, okay, yeah. You can
Good
proceed,
morning
sir.
to all. With pleasure, I welcome to you all to this session. This morning, I would like to talk about polycystic ovarian syndrome, risk factor for type 2 diabetes mellitus. These are the content of my talk: polycystic ovarian disease, causes and pathogenesis of PCOD, risk factors, management of PCOD, and studies carried out in our hospital, prevalence of type 2 diabetes mellitus in PCOD patients, the structured methodology which followed to analysis of this prevalence of type 2 diabetes mellitus, study tools and results. Polycystic ovarian disease or polycystic ovarian syndrome is globally emerging endocrine abnormality among 5% of the women in the age group of 12 to 45 years. The clinical manifestations of the disease include oligomenorrhea, amenorrhea, polycystic ovarian morphology, and frequent infertility. Most of the patients with PCOD are affected with insulin resistance, which causes type 2 diabetes mellitus, which is because of many comorbidities, includes metabolic syndrome. The clinical manifestations: oligomenorrhea, irregular menstruation, or amenorrhea because there is no ovulation in ovary due to the elevated level of male hormone in women. This leads to hirsutism, mild pattern hair growth at facial regions, neck, back, and chest, as well as the obesity, which is the main cause for the PCOD. All these together to form type 2 diabetes mellitus in PCOD patients. Polycystic ovarian syndrome is closely associated with so many cyst formation within the ovary. Because of this cyst formation, by means of the abnormal level of androgens, luteinizing hormone, and hyperinsulinemia, that will cause the enlargement of the ovary. So this is the normal ovary. There is a regular menstrual cycle or ovarian cycle with a periodic 28-day cycle. During this, primordial follicles, primary follicles, secondary follicles, matured ovarian follicle, where there is and secondary oocyte which present with the help of this luteinizing hormone as well as the androgen which secrete the estrogen, that all together promotes the ovulation process. So there is a regular ovulation after the puberty up to the menopause with the help of these hormones. But when the hormone levels are abnormal, once the androgen level is increased or LH hormone is increased, or by means of the hyperinsulinemia, it leads to the arrest of the ovulation. Because of that, abnormality is found in the ovary. So enlargement with the cysts. Cysts are nothing but small, immature Graafian follicles with the secondary oocyte. Gradually, it may be disappeared. If it is not disappeared, once if it ruptured, then we have to go for surgery. So these are the causes and pathogenesis of the polycystic ovarian disease. The causes includes excess insulin, genetic factor, environmental factor, low-grade inflammation, elevated level of luteinizing hormone, low-grade follicle stimulating hormone, hyperinsulinemia, and hyperandrogenism. How this pathology is caused? This is because either excess secretions of the insulin during the insulin resistance, the increased insulin, it stimulates the hypothalamus. As a result, gonadotropin releasing hormone is released from the hypothalamus, which stimulates the anterior lobe of the pituitary gland. There two irregularities are happen. One is LH level is increased, another one is FSH hormone level is decreased. Because of this LH hormone elevated, ultimately stimulate the Graafian follicle. So as a result, the ovulation is disturbed and also androgen level is increased, because within the Graafian follicles there is cells, that is Krebs cells. These cells are responsible to secrete the androgens. When excess LH stimulate the Graafian follicle means elevated level of androgens are produced. This elevated androgen causes two abnormalities. One is anovulation and another one is hirsutism. Another one, whenever there is insulin resistance, that it ultimately hyperglycemia, which by means of the feedback stimulate the excess insulin. The hyperinsulin, again, it disturbs the androgen level. The androgen level is normally 70 nanogram per 100 ml of the blood. So once if it is released into the bloodstream as an abnormal level, it should be bind with the insulin receptor binding globulin molecules. So because of the hyperinsulin, it disturbs the binding of the excess insulin with the androgen receptors. As a result, the abnormal level of androgens are produced within the bloodstream. This also leads to the polycystic ovarian morphology. Diagnosis of the PCOD, it is not a single test because it is based on the physical fitness, it is based on the blood test, and also it is based on the menstrual period. So as per the Rotterdam criteria, 2 out of 3 criteria. Here we need 3 criteria. One is regular or irregular menstrual period. There is no ovulation. That is the main criteria. Another one is elevated androgen level. So the elevated androgen level we are testing by blood test, or otherwise this symptom, either again symptom or hirsutism, or the abnormal level of the androgen leads to the obesity. And another one is Whenever the pelvic cysts are present, whenever the polycystic ovarian morpholysis exists, that should be diagnosed by using the pelvic ultrasound procedure. So I want to tell one thing, the term is polycystic ovarian syndrome, but in polycystic ovarian disease, we noticed that only 50% of the people are suffered with the polycystic ovarian morphology. Then the remaining PCOD patients are not having the problem of polycystic ovarian cyst. So the cyst may or may not be present within the ovary. So these are the excess elevated androgen. The androgens are the group of male sex hormone, which is also present in the female at low concentration, either in the ovary part or in the adrenaline cortex part. So excess androgens are in the form of testosterone, or it may be a dihydrotestosterone, or it may be a stilbestrone or stilbot estradiol. The androgen excess symptoms leads to hirsutism, again symptoms, and male pattern balding. See, these are the clinical signs usually we are observing in the PCOD patient. Hirsutism, this is excess hair growth in the woman at the areas of the face, back, chest, neck. It occupies 50% of the PCOD, and the obesity is because of the anabolic activity of androgens, which leads to the type 2 diabetes mellitus symptoms, and then male pattern balding and acanthosis nigricans. This is a very important symptom, but it is very rare only because this is insulin resistant causes. Insulin resistant, it causes acanthosis nigricans. There the symptoms are the neck part, we can see the hyperpigmentation, dark color skin at the neck region. Apart from 3 criteria, Rotterdam criteria, other diagnosis procedure, hypothyroidism, Cushing syndrome because of the excess secretion of androgen from the adrenaline gland, hyperprolactin hormone secretion from the anterior pituitary, ovarian hyperthecosis. As I said, within the Graafian follicle, there are cells, that is thecal cells. These cells are responsible to produce androgens. When the cell concentration is more, or when the ruptured Graafian follicle means these thecal cells are scattered within the stroma of the ovary. As a result, excess amount of androgens are produced. So we know that androgens are responsible to produce the estradiol within the ovary. But excess androgens means it's lead to abnormal ovulation, or there is no ovulation, or leads to infertility. Another one is congenital adrenal hyperplasia. This is nothing, adrenaline gland enlargement, and androgen screening, ovarian and adrenaline tumors. This is also symptom of PCOD. So these are the risk factors, the commonly occurred risk factors with the polycystic ovarian syndrome. Family history. This is oriented with the genetic factors. The family history, one's sibling have an polycystic ovarian syndrome, then another has an increased chance of PCOD. Or if mother had been the history of PCOD, there is an increased chance of PCOD in her daughter. So genetic variation, it is an inherited disorder. We can say this is not a single genetic disorder. So many genes are involved for the expression of PCOD characters. Then another factor is body mass index. So lifestyle modification is very important. Improper exercise, unhealthy diet leads to increased body mass index, which ultimately reflect the metabolic syndromes, hyperglycemia, hypertension, cardiovascular disorder. Whenever the body mass index is more than 25 to 29, it shows overweight. That is a risk for PCOD. The obesity is closely relevant to the body mass index. obesity, the weight loss is very important in case of the PCOD. So for that, a proper food habit, a food diet which contains low calorie carbohydrate, as well as the diet which contains low fat should be used to prevent the PCOD symptoms. The physical activity, the regular exercise, and the other physical activities are very important to regulate the PCOD symptoms. I would like to share with you about the management of PCOD. There are two types of management we are following. One is non-pharmacological management, and another one is pharmacological therapy treatment. The goal of the therapy is to correct the amenorrhea or menstrual abnormalities, to reduce the signs and symptoms of the PCOD, ultimately the patient quality to be improved. Non-pharmacological treatment is nothing but the first line treatment, we can say, that is healthy diet and regular exercise, that together to perform a proper lifestyle that ultimately reduces the body weight. So obesity is relevant to the PCOD abnormality. Whenever there is an excess androgen male hormone in the female, that is the main reason for the cause of polycystic ovarian syndrome. That is why infertility is caused. So the anabolic steroid, androgen, testosterone, it acts on its androgen receptors of the massive tissues like on the skeletal muscle or adipose tissue or at the liver part. So ultimately the deposit of the fatty substances leads to the obesity. Obesity is mainly caused by anabolic effect of the androgens. So to reduce the weight loss is the first line treatment for the treatment of PCOD. Now I would like to talk about the pharmacological management. As I told you, clearly there are two important clinical symptoms. One is irregular ovulation or there is no ovulation. There is no menstruation or irregular menstruation, and ovulation or oligo-ovulation. So we should induce the ovulation. This is the first treatment. Then second one is, because of the abnormal androgen hormone secretion from the graphene follicle of the ovary, hirsutism is the main symptom. So we have to induce the ovary to ovulate. Another one is we should suppress the elevated androgens. These are the main principles of the pharmacological management by using drugs. So what we are using to induce the ovulation, the major role for the pathophysiology of the arrest of ovulation in PCOD is FSH hormone, follicle stimulating hormone secretion is stopped or reduced. FSH hormone level is decreased. This is the reasonable factor for the maturation and growth of the ovarian follicle. FSH hormone also oriented with the LH hormone along with estrogen, they together to stimulate the graphene follicle to release the secondary oocyte, that is called ovulation. Now what we are doing, we are using clomiphene citrate. Clomiphene citrate, it is a drug. We are using 50 to 150 milligram after the third or fifth day of the menstrual cycle for 5 days. Clomiphene citrate. What it does do? Clomiphene citrate is a estrogen receptor antagonist. You know, estrogen progesterone hormone levels are elevated during the pregnancy, there is no ovulation. The same case, clomiphene citrate reduces the estrogen concentration level. So the negative feedback estrogen pathway is disturbed, estrogen level is decreased, FSH hormone level is raised. Then ultimately it is struck with the luteinizing hormone. So androgen level is decreased, estrogen hormone level is normalized and there will be ovulation. That is the beneficial effect of clomiphene citrate. Another one is tamoxifen. You know, that is used for the breast cancer. Usually we are giving 10 mg to 20 mg tamoxifen. The mechanism is similar to the clomiphene. It is an estrogen antagonist. Tamoxifen, when we are using, means whenever there is a clomiphene resistant, in that case we can use tamoxifen. Another one is metformin. This is the common drug. It is a biocoordinate drug which is used to treat the type 2 diabetes mellitus. Not only type 2, type 1 diabetes mellitus also, along with the insulin, we are using the metformin. The major mechanism of the metformin in relevant to the induction of the ovulation is it reduces the hyperinsulinemia. So whenever hyperinsulinemia is normalized, then insulin will not interfere with the gluconeogenesis within the ovary or the androgen synthesis. So there is an improved ovulation because of reduction of the hypersecretion of androgens. Another one drug is aromatase inhibitors. Aromatase inhibitors. See, the aromatase inhibitors, they are very essential for the synthesis of aromatase enzymes are essential for the synthesis of estrogen from the testosterone. So estrogen synthesis is decreased by using aromatase inhibitors. Say letrozole 2.5 mg, letrozole 2.5 mg OD we are using as an aromatase inhibitor. So there is no estrogen. Estrogen synthesis is decreased. FS hormone level is increased. This is the basic mechanism of aromatase inhibitors. We can use the aromatase inhibitor along with the metformin. Metformin, the frequency, the dose is 500 for 1 week, 1000 milligram per day for another 1 week. Then we are slowly increasing 1500 up to the maximum of 2500 milligram per day metformin. But along with the aromatase, metformin 500 mg is used to induce the ovulation. Another hormones, it is a direct gonadotropins, FSH hormone, 50 international unit per day we are using. The next one, we are looking how to prevent the hirsutism. This is because of elevated level of testosterone, androgens, epiandrogens. Oral contraceptive pills we are using, either the combination of estrogen progesterone or etheindrone or a single estrogen or progesterone, oral contraceptive pills. This is the logic. We know oral contraceptive pills, whenever a patient is treated with these hormones, the level of the estrogen progesterone is increased in the bloodstream. So ultimately, LH level is reduced. This is entirely different from the ovulation process, what we have used clomiphene. Clomiphene inhibits the estrogen pathway. But oral contraceptives promotes the negative feedback. Oral contraceptive pills, once the hormone levels are more in the bloodstream, LH hormone level is decreased. Ultimately, androgen level is decreased within the ovarian follicles. Another drug, finasteride. The finasteride is a 5-alpha reductase. 5-alpha reductase, that is the role where the testosterone is converted into more active dihydrotestosterone. So finasteride, it blocks the conversion of testosterone to dihydrotestosterone. So the level of the potential activity of the dihydrotestosterone is reduced. Then we are using glucocorticosteroidal drugs. Prednisolone we are using 15 milligram of the prednisolone or 7.5 milligram of the prednisolone. And also we are using hydrocortisone. Then insulin lowering agents, as usual metformin that we are using, and previously used rosiglitazone along with the metformin. Now we are not using that drug. Then topical treatment, ornithine decarboxylase. It is an enzyme. Ornithine decarboxylase is an enzyme. Whenever ornithine decarboxylase enzyme concentration is more, ornithine is completely converted into so many polyamine. Ornithine decarboxylase is responsible for the formation of so many polyamine from the ornithine. As a result, proliferation of the cell proliferation, that this is the reason for the cancer. So this ornithine decarboxylase enzyme should be blocked by using ethyl ornithine, EFL, ethyl ornithine. This is a drug that is used for the treatment of excess growth of the hair, because ornithine decarboxylase also present in the hair follicles. So that decarboxylase enzyme is blocked and hair growth is also disturbed. So it is applied in the form of cream on the affected area. Now, the important drugs used to minimize or to prevent the hirsutism, anti-androgens. These drugs blocks the androgen receptors, that is nuclear receptors. Androgen receptors are blocked. There is no binding capacity of the androgens with the androgen receptors. And also androgen synthesis within the graphene follicle also disturbed. But we are using spironolactone. You know, this is aldosterone antagonist. It is used as a diuretic drug. But for the treatment of hirsutism with the PCOD, we are using 100 to 200 milligram of spironolactone. But there is a symptom of hypotension, dizziness. Cyproterone acetate. This is also similar to spironolactone, but it also possesses progesterone activity. It is an anti-androgenic activity, but it possesses progesterone activity. It is an anti-androgen category. Cyproterone acetate that we are using 100 to 50 to 100 milligram per day. And another one is flutamide. This is used to treat the breast cancer. Flutamine we are using 500 milligram per day as an anti-androgen. Dear participant, now I want to explain about a study which was carried out to analyze the prevalence and risk factor of type 2 diabetes mellitus with the PCOD. This study was carried out in our hospital, KIMS Alsipa Hospital, which is located in the Pendalmanna, Malappuram district, Kerala. So a study on the prevalence and risk factors of the type 2 diabetes mellitus in PCOD patients and its management in a tertiary hospital. The objectives of the study to evaluate the prevalence of type 2 diabetes mellitus in PCOD, to evaluate the fertility status in PCOD patients, to analyze the management of the PCOD, to evaluate the risk factors for the PCOD, to correlate the relationship between the body mass index and consumption rate in PCOD patients, to analyze the prevalence of the risk factor among PCOD patients. These are our main objectives. And we follow
Hello, sir. Hello, sir.
Hello, sir.
a protocol with a well-designed LCPA, a multidisciplinary hospital. So it is a prospective observational study. The study was carried out in 160 patients. The patients were selected based on inclusion and exclusion criteria. The patients, those who are under treatment in the gynecology as well as the general medicine department, inpatient and outpatient of the gynecology department, and outpatients of the general medicine PCOD patients. The study was carried out for a period of 6 months with the aim to evaluate the prevalence and risk factors of the type 2 diabetes mellitus in PCOD patient and its management. So the same thing, 160 subjects were selected based on inclusion and exclusion criteria. 80 patients, I have divided into 2 groups. 80 patients are used to evaluate the prevalence of the type 2 diabetes mellitus. The remaining 80 patients were used to study the risk factors, the management of the PCOD, and the fertility analysis. So this study was aimed to evaluate the prevalence of the type 2 diabetes mellitus with its risk factor with the 3 phases of study. The phase 1 is the preparatory phase, just the identification and documentation of the materials essential for the prevalence as well as the risk factor. These everything is we have collected from the literature review. Phase 2 is a data collection. The patients, 60 patients, we have selected based on the few inclusion and exclusion criteria, and we formulated a data collection sheet, and the various data like demographic profile, age, sex, body mass index, religion, region-wise, weight-wise, demographic profiles, risk factors, hereditary factors, lifestyle, diet, and the medical history, signs, symptoms. The whole data were collected by using the data collection phase in phase 2, and phase 3 is all the collected data were combined and analyzed by using chi-square as well as the binomial test. The phase 1 is the preparatory phase. So identification and documentation of the prevalence of type 2 diabetes mellitus and risk factors of the PCOD, as well as the management of PCOD, all the parameters essential how to prepare a data collection form, that everything is prepared by using the literature review previous studies. Phase 2, inclusion and exclusion criteria, and then demographic data with the details of the patients were collected, prevalence of the type 2 diabetes mellitus as well as the risk factors were prospectively recorded. Patient case records also reviewed to collect the details of the medication and the test and other previous symptoms. Phase 3, analytical phase. So the collected data were compiled, analyzed, risk factor and management of the PCOD were separately analyzed. Then data were analyzed using binomial test, variant test, as well as the chi-square test based on the statistical significance. So how we selected the patients based on the inclusion criteria means patients with age between 14 to 45 years inclusion. If it is less than, we have not chosen. Inpatient and outpatient from the gynecology as well as general medicine. Patients with pregnancy also included. Then is there any post-pregnancy complications or occur? To analyze that one, the PCOD with the pregnancy patients also selected. And the patients with age below rejected. Patients admitted for diagnostic techniques also not included in this study. While considering the ethical consideration, we obtained the ethical clearance from the Human Ethical Clearance Committee in the Al-Shifa Hospital, and we also obtained an informed consent from the selected patients. So in the informed consent means the nature, type and intention of the study was explained to the patients by direct patient interview. The whole thing, what is the purpose, what we are using, what is the study, everything we explain to the patient. And those patients, those who are willing to join our study, that we have included, and we obtained a written official consent from the patients. So that is why they have decided to participate. A written official consent form was obtained after the informed details. So these are the data, how we have collected. One is a direct patient interview, patient case interview, patient prescription, and the patient medical records. We used two study tools. One is a data collection form, which include all the demographic risk factors, body mass index, lifestyle, age-wise, fertility, consumption rate. And another one is patient information leaflet. the patient information leaflet in a pictured manner be given to the patient, which shows explained to the patient. It itself explained to the patient. That is in local language we given the nature of the disease, what is the PCOD, what are the symptoms, what are the risk factors, what are the lifestyle should be adapted with the PCOD. Everything we explain to the patients by means of the patient information leaflet. So what are the content of the data collection form? Patient demographic profile, fertility status, risk factors, family history, past medical history, lab investigations, diagnosis report, medication chart, the frequency, dose of the drugs what they are using. Patient information leaflet, what I said, the disease information is there, sign and symptoms of the PCOD, risk factors, and preventive measures. So again, these are the objective: prevalence of type 2 diabetes mellitus in PCOD patient, age-wise distribution of the patients, distribution of body mass index, risk factors assessment, assessment of management and fertility stages. So what are our findings? The result shows that the prevalence of the diabetes mellitus out of 80 patients, 160 I told, 2 groups, 80 for the prevalence of the type 2 diabetes. So 80 population, 80 selected patients, we found that 15% PCOD patients are with the diabetes mellitus. 15% type 2 diabetes mellitus with the PCOD. That means around 12 patients out of 80 are with the type 2 diabetes mellitus, which shows a significant result. But as per the previous studies, we observed that 15 to 20% chances for the type 2 diabetes mellitus. Then we also analyzed age-wise distribution of the PCOD patient. So the majority of the PCOD patients are at the age of 21 to 25. 21 to 25. When the age is increasing, the PCOD, the ratio also decreases. And then the lifestyle modification is adopted with the region wise. Urban 71% with the PCOD, than that of the rural 29%. Body mass index is the main criteria. Body mass index. Here we didn't observe any obese patients. Obese patients, the ratio is very less. It is against this study, I think. But those who have overweight, we observed that 41% overweight, and also normal weight patients also with the PCOD. Signs and symptoms, what we studied: menstrual irregularities. Oligomenorrhea patients are with the 86.25%. Oligomenorrhea, 80% menstrual irregularity, 86, and then 80% with the polycystic ovarian morphology, as well as 73% with the male pattern hairing. This is a male pattern, excess growth of hairs at the facial hirsutism, we can say. So 86 menstrual irregularity, infertility, we have found more concentration in the PCOD patient. So risk factors among the PCOD patients, the main thing is the family history associated with the hereditary, and another one is food habit and lack of exercise, body mass index. So 60% with the hereditary, food habit, poor diet with the 35%, less physical activities 68%, and the body mass index, that is the main criteria. We found this is the main risk factor, body mass index, which leads to the cardiovascular disorder complications along with the PCOD. So fertility status also analyzed among the studied 80 PCOD patients. Normal fertility, we found just 17%, and that means 14 patients. Then difficulty in pregnancy, 58%, 25% is with continuous miscarriage. This is the relationship between the body mass index and consumption rate in married PCOD patients. We have selected almost all our PCOD married status only. So underweighing, normal weight, overweight, obese, and what we studied underweight, that is below 80 body mass index. Normal weight 18 to 25, overweight 25 to 30, obese about 30 body mass index kg per meter square. So here what we found that is normal weight, absence of consumption 31, overweight 31. These two are major risk factors for infertility, excess androgen level. Normal weight, overweight, where obese patient we didn't found any much difficulty. Distribution of the management among the PCOD patients. So out of 80 patients, normal, non-surgical and surgical we calculated, all are pharmacological treatment as well as the lifestyle modification treatment as the first line and second line treatment. So only few surgical treatment when ovarian cysts are present within the ovary and when it needs to require to remove the cyst, there they use the non-surgical procedure, laparoscopy manner. So these are the very important part, the drug which we used in the Alcipa hospital for the management of the PCOD. They used the chromifen, 47 patients. Chromifen. This chromifen, it is a chromium piclodine drug, chromium. Reduces the elevated sugar and will also it improves the ovulation. Chromifen along with vitamin D2, biotin, chromifen. Normos, similar to chromifen, Primol and N to reduce the androgen level, estrogen, progesterone, 31 patients. Redumet, it is nothing but metformin, 500 mg, 28 patients used. Gonatil, gonatilin is anti-androgen drug, anti-androgen hormone drug, 65 patients used. The maximum utility is gonatil. Then Meta-X capsule, similar to the combination of chromium, biotin, alcoferol. Then Ayurvedic syrup from various plant extract, Foxis 200 ml syrup, they used the frequency of 53 patients, 53. And another one is Meptal. This Medital is nothing but it is a combination of 250 milligram of metformin along with the inositol. So there 35 patients utilized the Medipol. So what we observed is anti-androgen hormone drugs, gonadin is used to the more patient PCOD patients rather than the metformin. So from our study, what I have concluded, I found that hereditary, lifestyle modification, poor exercise, poor diet, body mass index, these are the main risk factors for the PCOD associated with the type 2 diabetes mellitus. So these risk factors should be minimized to reduce the symptoms, complication associated with the PCOD, whether the hypertension or hyperlipidemia or diabetes mellitus or cardiovascular disorder. So lifestyle modification is very important because observed that 14% of the PCOD patients are with the type 2 diabetes mellitus. So that also associated with secondary complications, long-term complications like cardiovascular disorders, long-term complications also observed in the PCOD patients, risk factors, what we have studied, including the PCOD with conceived patients, we observed gestational diabetes, gestational hypertension. So these are the risk factors both for mortality and morbidity wise to the mother and the child. So a systematic, well-structured educational program is essential to the patients with the PCOD. Especially, we should give a care to the conceived patients, those who have the symptom of gestational diabetes, hypertension, to avoid the complications, to avoid the miscarriage, to avoid the pregnancy delivery complications. So a well-structured lifestyle adaptation, modification, lifestyle oriented education is very important to minimize the PCOD along with the type 2 diabetes mellitus as an associated symptom. So thank you very much for your patient listening.
So thank you, sir. And thank you so much, sir. So this session is now open for queries and questions. Those who have any queries, please, you can put it in the chat box, in the Zoom chat box. And those who have queries, those who are watching in that of your video in the YouTube, you can put it in that of your YouTube chat box. It will be represented to that of your Dr. Balasubramanian, sir. So those who, all the participants, those who have any queries, you can put it in your chat box, Zoom chat box, as well as those who are in the Zoom, you can put it in the Zoom chat box. Those who are watching in the YouTube live, you can put it in that of your YouTube chat box also. So we'll be representing the question to that of your Dr. Balasubramanian, sir. Sir,
Yes,
sir?
yes, yes.
Yeah, there is a query from participant issue. Is this disease curable or else only controllable, sir?
Yeah. It won't be curable. Symptomatically, we can treat the disease. Only symptomatic treatment, we can minimize the symptom to induce the ovulation and to avoid the risk factors. It is a common disorder in the woman. I told that 5% of the women are at the duration of the reproductive ages, they have the problem of the polycystic ovarian syndrome, and it is a symptomatic treatment. It is not curable one.
Okay,
but we can.
There is another question from yes, sir.
Yes.
So there is another question from Shrutika, participant Shrutika. Nowadays, women is suffering from hyperthyroidism and also having PCOD. Is there any intercourse between this disease?
Yeah. So what we are really observing this, hypothyroidism is the main risk factor. As a diagnosis, hypothyroidism only is a risk factor. But in certain cases, we can see that the elevated level of the thyroxine. Why? Because of this thyroxine level is increased means this is certain cases, if there is a stress, for example, stress, when it stimulates the parts of these hypothalamus regions, stress oriented. In that cases, we can see the thyroid stimulating hormone level is increased. Ultimately, it stimulates the thyroid hormones. So there is a chance for the hyperthyroidism that it may be very, very, very less concentration we can observe in the PCOD with the hyperthyroidism.
Thank you, sir. Another one question from Sanjana Jadhav, participant. How much time it is required to cure the PCOD with all exercise and diet?
Yeah. So I told that, see, we can minimize the symptoms. We can minimize the symptom. See, we cannot cure the disease. We can minimize. We can improve the ovulation, or we can reduce the obesity-oriented lifestyle whenever we are following the proper exercise, physical activities, well diet with low calorie value, low diet with low fat. In that, if we continue, we can regulate the obesity. Otherwise, exercise we can minimize, but thing is genetically androgen level is more. That itself, if you stop the exercise, there is a chance for again obesity, because androgen will do the excess mass of tissues.
Thank you, sir. There is another question from Vaishali Chavan, participant. Stress is responsible for PCOD? Whether stress is responsible for PCOD?
Yeah. Stress means what I want to tell, it is relevant to a matter of the factors, the cytokine factors, stress oriented inflammatory stresses. It is not all the stress. This stress, the natural stress, the tension and these things are not much affected with this. The stress factors are genetically oriented factors like cytokines factors or the what we can say hyper insulin stress. This stress, it is not a stress because of our physical stresses.
Yes, sir. Thank you, sir. There is another question from Rumisa participant. Are the women with PCOS greater risk of miscarriage?
Yeah, that is why we see we observed around 42 47 patients, 47 persons out of 80, they had a problem of miscarriage.
Yes, sir. Thank you, sir. There is another question from Vaishnavi Shiva. Sir, will the intake of those drugs cause complication in future? When the drugs which is used for the treatment, which will be producing any complication in future? By
Very good, very nice
Vaishnavi
question.
Shiva from YouTube, actually.
Very nice questions. See,
Yeah.
this is the drug which we have used, which we observed in our hospital, just metformin and remaining all are nutrient oriented. So, but the drug which I shown generally what we are using, say for example, spironolactone, or in the case of the clomiphene, which is used to induce the ovulation, they have more side effect.
Thank
So
you,
in
sir.
prolonged use that we should avoid. But clomiphene we are using just 5 days. We are not using more than that.
Sir, thank you, sir. There is another question from participant from Hina Chaudhary, and the question is, then what we can done for the fertility, sir? Those who are having the fertility problems, so what could be done for that actually? Please mute yourself, sir, actually.
Answer is very clear. It is behind that only. There is a PCOD. We have to minimize the symptom. We have to induce the ovulation process, or we have to reduce the androgens level.
Hello.
If it is beyond that, then we have to go for some other procedure like IVF or something. You should go for IVF, and that also with the management, with the drug only, we have to improve the development of the fetus within the uterus. So very carefully we have to observe the pregnant woman.
Yes, sir. Yes, sir. So thank you, sir. There is another question from Rumisa participants. And does environmental factor cause PCOD?
So the environmental factors is, see what I said, environmental factors is this oriented with the physical exercise. I said that the risk factors of the diet, I told that these environmental are mainly responsible for the obesity. So obesity oriented PCOD.
Okay, sir. Thank you, sir. There is another, again, second question by issue participant. Sir, fibroid uterus and PCOD related are same?
Which one?
Fibroid uterus and PCOD related are same?
Oh, I'm sorry. I'm not aware of that one. I'm not aware of that.
Okay, sir. Thank you, sir. And another question. Yeah, another question from Rumi. Please mute yourself, audience, please. Yeah. So another question from Rumisa participants. Which precautions women should with the PCOD have taking during the pregnancy? What are the precautions should be taken in order to avoid that during the pregnancy?
So this precaution, I told everything what I explained, all these risk factors we should follow, right? Everything, all the risk factors. Yeah,
Yes, sir.
There is no.
Yeah, thank you, sir. And yes, sir.
Yes,
Sir has explained all the things in that of you during the session, I think so. And another question from Syed Mohammed, participant. PCOD cause any fetus abnormalities?
Yeah. That is a chance for when there is a chance for fetal abnormalities in PCOD patients. So many factors are behind these PCOD patients with the fetal abnormalities.
Thank you, sir. So there is another question from Shivani Pawar, participant. Any side effect because of artificial hormone changes?
So whenever we use the hormones, or almost what we are using for the PCOD steroidal hormones we are using. So definitely it causes so many complicated adverse effects. Again, it can raise the blood sugar level, or it causes the effect on the eye part. So many complicated disorders. But what we are using in the Ayurvedic preparation treatment, what I said, the treatment, that it doesn't have any steroidal hormones. It doesn't have any steroidal hormones. So that is why we in our hospital, they are using the drugs without the steroid. We are not using prednisolone or any other steroidal hormones.
Thank you, sir. There is another question from Professor Ravindra G. Mali. Sir, is there any correlation between the obesity and PCOD?
Yeah, this is the main risk factor. No, obesity. You see, why this obesity is not only because of poor diet. It is not only because of unhealthy food habit. So obesity is in PCOD mainly because of that androgens. Androgens. If you see that androgens, two properties are there. One is an androgenic property, another one is anabolic property, right? So the anabolic property of the androgen, excess elevated male hormone in the female, is responsible for the obesity. Whenever the obesity is more, the obese condition, again, it induces the insulin level, because obesity is relevant to hyperinsulinemia. So as a result, insulin stimulate the Graafian follicle of the PCOD, then excess androgen again. There is no ovulation, disturbances, anovulation, oligoovulation, irregular menstruality, then arrest of ovulation, infertility. So obesity is the main factor.
Thank you, sir. And there is another question from Kalinga. How many days medication is required, sir?
Yeah. See, this is based on the symptomatic. So if you want to just some patients, if they require the consumption, minimum 4-month continuous treatment is very essential. After that, these drugs like clomiphene or the drugs like tamoxifen, that we are all stopping. But we are continuing with the chromium, then biotin containing drug, then inositol containing drugs, that should be continued up to 8th month of the pregnancy.
Thank you, sir. There is a question from Jinos Asmali. Sir, if any woman has PCOD, had taken the treatment, if she got pregnant, whether she had to continue the treatment?
Yeah. If yes, conceived that one, then again she should take the treatment. Up to, I told that up to 7 to 8 months she has to continue with this one. Only drugs as a supplement, nutritional drugs we have to give. Nutritional, not for any other ovulation or anti-androgen. It is not essential.
Okay, sir. Thank you so much. And I think there is so many queries are there, because of time limit. We are winding it. So I would like to conclude the session. Thank you so much, sir.
Dr. Karthikeyan, sir, I have one doubt. Then one question I didn't answer. What is that question?
Which one, sir?
What difference between PCOD and one more thing? It is not clear either. I want to.
Fibroid.
One question you asked. Fibroid is something.
Yeah, I'll tell you that.
Is it same? Fibroid is same.
Okay.
Yes, sir, fibroid, uterus, and PCOD related or same.
Okay. That I have to wait.
Okay, sir.
Not clear.
Yeah, sir. I would like to conclude the session. Dr. Balasubramanian sir has shared his research experience in the polycystic ovarian syndrome, a risk factor for type 2 diabetes. Sir has covered broadly about basically starting from the PCOD, what is PCOD, what's the causes, and what is the pathogenesis of that, and also he covered what is the risk factors and also how to manage with that of your pharmacological management, non-pharmacological management, and he's also taken the prevalence of that of your relation to the type 2 diabetes, and what are the methodology he followed during his study, and also he shared the study tools, and also what are the that is parameters and all the results Sir got in that of during that of his studies. And I'm very thankful to Dr. Balasubramanian sir. He's a professor and HOD of Pharmacology Department, Al-Shifa College of Pharmacy, on behalf of Sydus Publishing, Kerala, India, and also in association with that of your the Kalinga Biomedical Science and Research Training and Establishment, Odisha. I am very thankful to you, sir. And thank you so much, sir, for your session. Wonderful and informative session. Sir has cleared all the queries and doubts of that of you through the YouTube as well as in that of your Zoom platform. I am very thankful to you, sir, for your session. And I'd like to share one thing. Sir is my PhD guide. Thank you so much, sir. Thank you so much.
Thank you, Dr. Karthikeyan. I would like to say the thanks also for your invitation, and I appreciate Dr. Karthikeyan because he is organizing so many webinars during this COVID period. Thank you, Dr. Karthikeyan.
Thank you, sir. Sir, you can stop sharing your slide. Sir, you can stop sharing the slides.
Yes.
So the next session will be by Dr. Deepa MK. The topic on development of nanoparticle based drug formulation and impact in disease management. Dr. Deepa Madam is working as an associate professor in the Department of Pharmaceutical, Ashok Ramani College of Pharmacy, Kolhapur, Maharashtra. So I would like to introduce Dr. Deepa. Dr. Deepa is an associate professor at Pharmaceutics, Department of Pharmaceutics, Ashok Ramani College of Pharmacy, Kolhapur, Maharashtra. She obtained his B.Pharm from Tamil Nadu Dr. MGR Medical University, Chennai, Tamil Nadu. And he is obtained his M.Pharmacy from SRM University, Chennai. And he is obtained his PhD in pharmaceutics from Shingani University, Rajasthan. She has 13 years of teaching and research experience. She has guided B.Pharm and M.Pharm students. His area of interest is nanoparticulated drug delivery for the colorectal cancer, development of silver nanoparticle, floating drug delivery system, micro encapsulated drug delivery system, and solid lipid nanoparticle drug delivery system. She has published more than 34 research and review articles in national and international peer-reviewed journals. She has presented papers in various national conferences, and she has delivered 2 talks. So with this brief introduction, I would like to invite Dr. Deepa Madam to deliver this lecture, the topic on development of nanoparticulate based drug formulation and its impact in disease management. Madam, please.
Thank you, Karthikeyan sir, for the nice introduction. Good morning, one and all. Present over here. Before moving to my topic, I'll tell you why I choose this topic. Means I came to know that most of our participants are students only. Okay, so I plan to take it as a two-part. First part of my session will be dealing with the introduction of nanoparticle to have a nice understanding for our students community, and we'll move to the research experience that I had during my teaching experience. So the topic I have selected is development of nanoparticle based drug formulation and its impact in disease management. So as I told before, I have two parts to discuss today. First part, introduction to nanoparticle and its impact. Then I am moving to the what are the different types of nanoparticle, synthesis of nanoparticle, characterization, biomedical application. Then I'll be talking about some research experience that I had during my experience. I have developed this silver nanoparticle drug delivery system for the treatment of cancer, silver nanoparticulated drug delivery system for the treatment of gastric ulcer, silver nanoparticle drug delivery system for infectious disease, ceramic nanoparticulate drug delivery system for periodontitis, and development of solid lipid nanoparticle for permeation of bioavailability, enhancement of bioavailability. Let's move to the first slide. Introduction to nanotechnology. As all of you know that nanotechnology refers to the branch of engineering dealing with the things smaller than 100 nanometer. Nanotechnology is the field of research and innovation concerned with the building things, generally materials and devices on the scale of atom, and device to investigate whether it have direct control on the matter of atomic scale. We know that nowadays we are using that mobile, in that we have a SIM. The SIM have the capacity to carry lot many data, right? So even though it's a chip is made of nano size. So when you are making the particle in nano size, it can have its own property. We'll see what is the impact of why we need the nanoscale. So first of all, let me invite your attention to this slide. Here you can see that we have several drug delivery systems like mesoles, liposomes, dendrimers, condensed dots, and metal nanoparticle polymers, etc. Right? When you have a look on the particle size of biomedicals, you see the glucose is having less than 1 nanometer size. What about the protein and virus? It's within the range of 1 to 100 nanometer. When look into the cells, nowadays we are targeting the cancerogenic cells and all. So we should have an idea what should be our drugs particle size in order to target our area, right? Then come to the salt grain, as well as finally we are going to compare with the tennis ball. As compared to tennis, we can have an idea regarding our nanoparticle, how we are utilizing the technology to make a particle in nano size. What actually happens when the object turns to small? You can have a look in the diagram that we can see the just for example, let it be a metal, gold. Okay, so when you see the size is reduced, what happened to surface area? Here the surface area also be increasing according to reducing the particle size, right? Same, when we are comparing the property, we can know that just have a look in the color change. Say colloidal gold solution. Okay. When there is a decrease in the particle size, there is a change in the color also. That indicate that some physical property may be changed when it is turns to the nano size. Will have the object usually have the constant physical property regardless of its size. But at the nano scale, the size depend property are often observed. That's what we are getting different color here. Okay. Properties of material change as the size approaches to nanoscale, as there is a vast increase in the ratio of surface area that we are seeing in the diagram. For the materials larger than 1 micrometer, the percentage of atoms at the surface is significant in the relation to the number of atoms in the metal. We'll move to the different types of nanoparticle. We have metal nanoparticle, which include silver, gold, whatever, the metal nanoparticle. Then ceramic nanoparticles are these are the inorganic particles. And then we have polymeric nanoparticle. We have seen some diagram of liposomes and all. Sorry, that polymeric nanoparticles. Then carbon-based nanoparticle. Finally, lipid-based nanoparticles such as liposomes, solid-lipid nanoparticle. Okay, these are the different types of nanoparticles. Now come to the synthesis of nanoparticle. When we look at the synthesis of nanoparticle, we have two major approaches. One is called as top-down technology. Another one is called as bottom-up technology. We'll see what is the difference between these. Here you can see the bulk material. Okay, the bulk material, that is top-down approach I am telling. Bulk material goes to fine powder. Again, very fine powder. So this approach is called as top-down approaches. We can adapt any milling technology in order to make the particle in nano size. Okay. Now second term is bottom-up approach. Here we can see the particle might be in the atom, right? So the clusters of atom we can see finally it leads to the nanoparticle. So these are the two approaches I want to discuss here. So these are the different technology we can use for top-down technology. I told you, no? Mechanical grinding, metal vapor, thermal breakdown, chemical breakdown, spontaneous chemisorption. These are the technique to get your particle nano size. We have bottom-up technology like Sol-gel method, precipitation, chemical reduction, solvothermal processing, electrochemistry, template, direct and sonochemistry, microwave radiation and microencapsulation, that is microemulsion. Now come to the characterization. Once we prepared the nanoparticle, we have to ensure that whether it become nano size. So we can go the characterization of the nano materials. We have two approaches. One is microscopy analysis. This is the technology we will use, analytical technology, in order to ensure the morphology as well as particle size of your material. Okay. Next is spectroscopic analysis. You want to know the energy level. If you want to know any elements are present there, as well as if you want to know whether nanoparticle has formed by UV, simple method is UV while visible spectroscopy. Another Raman spectroscopy also we can adopt for particle size determination. And we have FTIR in order to find any conductivity. So these are the technique we are using for characterization. When we are discussing the research topic, all the characterization parameter will be. We have the atomic force microscopy as well as transmission electron microscopy, scanning electron microscopy. This all technology will use in case of nanoparticle characterization in order to ensure the particles, whether morphology or maybe morphology or particle size. In case of energy dispersed X-ray spectroscopy, we can especially find the element Okay, element present in that particular compound. In case of metal nanoparticle, it will be very useful. Then electron energy low spectroscopy is the ultraviolet. I discussed already Raman spectroscopy and FT. Yeah. I'll come to the biomedical application. We know that we are using nanotechnology in vast and wide manner in the biomedical application, especially cancer targeting. Okay, so here my area of interest is development of silver nanoparticle for the cancer development. Sorry, anti-cancer drug delivery. So this is the example I given here. So this is represented the gold nanoparticle. When at how it is entered to the cell, we have discussed the size of particle already, so you can easily get into the cell. Okay, because of the special biology of the disease cell, so it will won't affect your normal cell. It will be target only the cancerogenious cell only. So we can have some active or passive stimuli in order to work it. Okay, researchers are finding more technology in order to target the medicine in the cancerogenious cell. So not only for treatment, we can use for the diagnostic purpose also. We can incorporate some by functional modification. We can multifunctional therapy of nanoparticle we can employ. We can some images we can incorporate with your formulation, and we'll get the image of the cancerogenious cells. So the therapy will be easy as compared to conventional therapy. Okay, now there is a big question mark regarding the safety issue. Even though we have lot many advantages with the nanotechnology, nanoparticle, still there is a question mark of the biosafety because it's nano size. We know that nano size it may interfere with the body function. So it's very difficult to get eliminate from the body. These are the two challenges we are facing when we are discussing biomedical application of nanoparticle. Now come to the part 2. I'm going to share my research experience. This slide I already discussed. Once again, let me go through this same slide. Development of silver nanoparticle. So when we are discussing silver nanoparticle, as we discussed before, we have top down as well as bottom down approaches. Okay, this part we'll discuss already. Now I'll move to the what are the various methods in the development of silver nanoparticle. Okay, we can go for physical method by simple size reduction, or we can go for the chemical method and biological method. Chemical and biology method we are using biomedicine. Okay, physical method generally we are using for other than application of nanotechnology. Now I'll come to the metal ion. First, if it is grinding method, whatever it may, first we'll have to consider the fine metal ions. Okay, generally in case of development of silver nanoparticle, we'll prefer silver nitrate. When you're taking silver nitrate, you have to ensure that you must use deionized water. Why? Because means if it is interfere with any salt, we won't get the proper result. So what does this biological or chemical method, what they are doing? They are giving a capping over the metal. So we have the metal in ion in solution of silver nitrate. When you are treating with the extract, either maybe biological method, we will be treating with the plant extract, or with the help of microbes, we will be doing the procedure. At that time, each metal ion will be have a capping with the extract. We know that if you are considering plant extract, we have lot many phytoconstituents. It can have a protective capping over this, and it leads to formation of nucleation and finally metal nanoparticle. Now come to the chemical method. Chemical method also nowadays we are using co-precipitation, chemical reduction method, and electrochemical methods. Lot many methods are there. What is the drawback associated with this chemical method means we have to use the solvent, non-aqueous solvents. So it may lead to toxicity. So in order to avoid that, we usually prefer plant extract or microorganisms also we have some issues. So better we can choose, that is my opinion, plant extract. So this we discussed. Now I'll come to the nanoparticulate drug transdermal patches for Cantharanthus roseus for breast cancer. This is a well-known plant. We call
बात है
Vinca.
गुड मॉर्निंग मैडम हाउ मेनी डेज
We'll come to the objective first. Nanoparticulate transdermal patches of Vinca for breast cancer treatment. So this is a well-known plant. Okay. So first we have to take the aqueous extract of the particular plant. What you can use any plant. Here particularly we used Vinca. We know that already Vinca have proved its anti-cancer activity. So we can sound enough, we can tell that it should have the anti-cancer activity. So it will be giving a supporting effect to our formulation. So first we have taken the plant extract, then we incorporated with the silver nitrate solution. It's at room temperature only. We got the silver nanoparticle within fraction of time. So let me introduce what are the methodology phases we adopted. We have done the formulation development by two methods. First aim is to develop and evaluate silver nanoparticle. Second phase, we have incorporated the silver nanoparticle what we formed first, that in the patches. So let me introduce this purpose. So formulation over, we have taken Vinca, we have taken the aqueous extract of the same, and we incorporate the silver nitrate solution, that is also millimolar concentration only. Then at the room temperature, it's a very simple method and safe also. That's why we are calling eco-friendly method. We are not using any chemical, any solvent, organic solvent and all. So first we have done the UV visible spectral analysis. Next we gone for the TEM analysis in order to get the particle size, and XRD in order to understand the crystallinity, and we gone for the in vitro anti-cancer study. So next part, once we've completed the characterization part, we move to the formulation development, that is incorporation of the silver nanoparticles that into the transdermal patches. Okay, once we prepared the patches, we gone for some evaluation parameter, solubility study, and some then drug release study also. We'll see the formulation step. As I told you now, first you can see the test tubes here. The A test tube, we have pure 1 millimolar silver nitrate solution. You can see that in the B test, we have silver nitrate solution along with the extract after 2 hours of incubation at the room temperature. Whereas in the C, after 3 hours, likewise we observe different time period over 24 hours. Fraction of second, we can see that the color change that indicate the nanoparticle has been formed. Then the same time itself, we observe the absorbance and we found that a particular peak, that is in between 400 to 300, we scan from 200 to 800, we observe that 420 preferably we got the sharp peak that indicates that nanoparticle has been formed. So this is the nanoparticle we found in powder form. After centrifugation only, You have to use the cooling centrifuge at the high shear, then only we'll get the fine particle. We can characterization of silver. Once we completed the session, we have chosen HRTM microscope for silver nanoparticle. This indicate that we got the particle in nano size. You can see the size also is almost spherical in shape. So we have done the XRD for further clarification of the crystallinity. Then we did the MTT assay, cell viability study we have performed. Okay, we use the cell line of MCF7 for breast cancer. We are targeting breast cancer only. We have used different concentration such as 250 microgram per ml, 125, 62.5, 31.2 microgram per ml. We have found that when we look the absorbance, we came to the conclusion that we got the maximum viability at the concentration 31.25 microgram per ml. That is 92 is 93%, near to 93. Then fabrication of transdermal patches. Next, our step is development of drug delivery system. So that we have used the polymeric blend such as HPMC, hydroxypropyl methyl cellulose, and PVPK30. We have taken various concentration of polymer as well as the drug 1:1, 2:3, 1:2, 3:2, 2:1, 3:1, and 4:1. So we have used polyethylene glycol 400, 280. These are the formula for fabrication of baking layer. So we'll move to the fabrication of baking layer. This is the image indicate that we have taken petri dish only for performing the experiment. We pour 4% polyvinyl alcohol to the petri dish. Later on, we kept it to get a smooth patches. So this is called lining. Okay, later on we removed with the forceps. Backing layer with form. Then fabrication of material matrix layer. For that we have a pouring of drug in the polymeric solution. We have seen the composition already. The particular composition we added in the petri dish. Then petri plate containing polymer solution is shown in the B. Then we, with the help of spatula, we just remove the matrix layer. And next step is sealing the edges. Okay, pasting the pre-prepared. We already make it plaster only we used. Then backing layer also we fix with that. This is the way conventional method of preparation of what we say transdermal patches. Now we come to the evaluation of silver nanoparticle loaded patches. Now our silver nanoparticle we had loaded in the patches. Now we want to evaluate the formulation. Folding and pressure, thickness, percentage moisture absorption, percentage moisture loss, mass variation, and percentage drug content. These are the parameters we observe and come to the conclusion. I didn't include all the research work here. We have performed the drug release study also. It was concluded that optimized green synthesized silver nanoparticle ordered transfer matrix type drug release system exhibit better and promising approach for the breast cancer drug. Let me move to another study, that is formulation and characterization of green synthesis silver nanoparticle loaded mucoadhesive microspheres for treatment of gasticles. Here also we are done in two phases. First phase, development of silver nanoparticle by the plant industry. Second one, we loaded the same in the mucoadhesive, that is in the polymer. As all of you know that peptic ulcer, to describe the condition, there is a discontinuity in the ender thickness. that persists as a result of acid and pepsin in the gastric juice. This image shows that H. pylori, the peptic ulcer, are generally caused by the acid-resistant bacteria H. pylori. So we focused on the microbial activity also against the H. pylori only. Come to the objective. We want to formulate silver nanoparticle using aqueous extract. Glyceria globera is the root we generally will be using for peptic ulcer. So we selected the plant to develop a gastroretentive green synthesized silver nanoparticle loaded mucoadhesive microsphere. In order to get a mucoadhesive property, we have used carbopol as the polymer. So we finally did the in vitro antimicrobial study, broth dilution as well as that of zone of inhibition. Here we use the material I have introduced already. This is the plant we chosen because traditional herb only is already used for the treatment of gastric. These are the material we use: silver nitrate, carbopol, is a polymer, alginate, calcium chloride. Now I'll come to the methodology. The plant root only we use here is washed several times with the deionized, I mentioned now, deionized water we have to use for the purpose. And 50 ml of root were finely cut. 50 gram of root was finely washed. First we wash with the deionized water, then cut it into small pieces. Boil 150 ml of deionized water at 100 degrees Celsius for 5 minutes. 5 minutes only we just boil it. Aqueous leaf extract was filtered. We use Wardman filter number 1. 7 ml of extract we added 100 ml of aqueous solution of silver nitrate, 5 into 10 raised to minus 4 millimolar concentration only we use. Stir continue for 10 minutes. Because within 10 minutes itself the particle has been developed. So once we develop silver nanoparticle, we have gone for the second phase of our aim, that is incorporation of the silver nanoparticle into microspheres. Here we adopt a simple method that is orifice ionic gelation technology. Here in the syringe you can see that we have taken our drug, that is the polymer what we used is carbopol, because we need that mucoadhesive property. We are targeting the gastric and the region of the gastric region, so we are respecting the mucoadhesive property. So sodium alginate we are used, calcium chloride solution we are taken in this beaker. Then you can see that we introduce this is the silver nanoparticle we are taken. Alginate and carbopol are the polymers used in the calcium chloride. You can see that in the beaker down we have the calcium chloride that we are made different trial. We found that 4% calcium chloride showing better formation of the microspheres. So we have selected that particular, then we kept it on the stirrer, magnetic stirrer. Then we slowly introduce the drug polymer to that calcium chloride solution. We can see that small microbeads has been formed. Once we got that, again we perform that. This is the characterization of silver nanoparticle. So this is XRD pattern we observe. Then move to the antimicrobial study. I told now we have done zone of inhibition that are not included here. Here you can see the different concentration: 125, 250, 500, 1000 microgram per ml. These are the various concentration of drug we used. Then we got better effect with the study. Drug release study also we perform. Here you can see the percentage drug release versus time plotted. These are the kinetic drug release parameter we observe. So this plot says that have a good control over, we can use call it as a sustained release property. Then come to the resultant discussion. We already discussed the TEM analysis we perform. We got the average particle size 90 nanometer. Then we found the XRD. There we got a crystalline nature. We confirm by XRD. Then SCM we perform in order to, we have the mucoadhesive microspheres. That's why we perform the SCM to know whether we got the spherical shape. Then we perform the drug release analysis. There we found that the data feed for Higuchi as well as Cosmopopon. So from this data, we came to know that we can have a controlled release over the gastric. So the in vitro anti-ulcer activity, that is microbe both dilution as well as this other diffusion, says that it have a good effect on H. pylori. In the concentration of 500 microgram per ml only, we got a minimum inhibitory concentration. Okay, so the particles are once again. Okay. Now move to the okay. I think it is visible now. One second. Sorry for the inconvenience. Just a minute. Yes, yes. I think it's visible. So next work I want to discuss with you the development of nanoparticle drug delivery for the periodontitis application. So periodontitis is the chronic inflammation disease affecting the gum and teeth. You can see the image here. I have shown two parts. One is healthy gum you can see, whereas the next side you can see the periodontal diseased. Some gums has been degraded. So the disease usually start from simple gum and infection that gradually progress to chronic and finally is inflammation. This is known as periodontitis. Or come to the objective to prepare a curcumin loaded. Curcumin is well known antimicrobial property with the antimicrobial property. The curcumin loaded micelle and incorporate the loaded micelle into ceramic and make it as a formulation for periodontitis. This is our aim. First we have selected curcumin. We know that it's agglomerate. These pictures show that agglomerated one. So we can't expect much effect in antibacterial property. So when it is in nanoparticle size, you see that. So the size reduction, we have done the size reduction. Now it's nano size, the two ceramic with the ceramic. So it can easily kill the bacteria. So methodology, when we discuss methodology, these are synthesis part and these are characterization. Developing mycelia of the drug, developing ceramic particle. Developing mycelia of the drug, developing ceramic particle, combining them to develop a formulation, optimize the formulation with the improved drug stability, and we are chosen the drug curcumin. Come to the characterization. In vitro in vivo study we have performed. In vitro characterization like DLS, UV visible, FTIR, NMR, SPTLC, DSC, and finally we end with the in vivo studies using rat model. So we'll move to the methodology first. The first step is synthesis and characterization of curcumin loaded nanoparticles. The procedure involves 30 milligram of the puronic acid was dissolved in 10 ml of the dimethyl formamide. Then dissolve 5 ml of curcumin into this. This DMF solution was directly dialysis for 24 hours against 3 ml of ultra pure water using cellulose dialysis method. So this is the formulation what we got. Now come to the second part, synthesis and characterization of prodrug, curcumin prodrug. We know that we want to enhance the solubility first of all. So the prodrug nanoparticle. So we have make the complex with barium as well as calcium. Complexation with barium, you see, we have a comparison with it. After complexation, we found yellow color. After complexation, color hygroscopic due to the absence of curcumin. So we didn't get much effect with the calcium chloride when we are make the complex with this. Barium chloride showed better effect. Solubility also. We got better solubility in case of barium when we got, but whereas in the case of calcium, we have sparingly soluble. And encapsulation efficiency also we found to be good with the barium. So we have selected barium for the first study. Then the entrapment efficiency, as I told, we got the better entrapment. The figures shows the table shows that the better encapsulation efficiency with that of your barium, not with the calcium. Come to the third part, that is synthesis of polycrystalline ceramic. For different type of ceramic varying from calcium nitrate tetrahydrate. See the concentration of calcium we have 5.9 gram, 11.8, 17.7 and 23.6 gram. These are the different varying concentration of calcium nitrate tetrahydrate we used for preparation of the polycrystalline ceramic. Come to the stability of, when we are considering the stability study, we have plot a graph against percentage degradation versus hour. This red color indicates the polymerization of calcium green color with the polymer barium, as well as curcumin loaded polymers we can see in the blue color. So as we discussed before, calcium didn't give much effect endorsement efficiency. When we discussed the solubility endorsement efficiency, we didn't get a good formulation with this. So we consider the barium polymerase for the further study. Then degradation study of polycrystalline ceramic particle also we have the comparison. This may be due to the spontaneous dissolution of the particle during the first day. So we can see that here actually I forgot to keep here the percentage degradation versus days only. Then some stabilization occurs after some time. So isoceramic particle after centrifugation. We perform the experiment in various time period, first 5 minutes, later 10 minutes and 15 minutes. We found the particle mean size also. Then polydispersion index also we found. These are the data we obtained. Then we performed the antimicrobial study. We found that a significant effect of curcumin formulation against E. coli. Well diffusion assay we performed and diffusion we have distribution assay. Finally, we end with the in vivo study. We have performed this at Nagarakulja Pharmacy with the ethical clearance. We have used the animal mode, Mr. Rat, and ligature method is the inclusion periodontitis we have adapted. Then here you can see the inflammation after treatment, that inflammation has been cured. We have gone to, let us see the histopathology of the same. The first figure is without any treatment. Here you can see curcumin treatment as well as curcumin variant loaded polymerase, or but that is selected optimized formulation only we have selected for the in vivo study. So you can see the gap, that a gap indicates that how much the inflammation has been caused. So the development of aspirin loaded solid lipid nanoparticle. So far we discussed regarding silver, how to develop silver nanoparticle and ceramic nanoparticle. Now we'll move to the development of aspirin loaded solid lipid nanoparticle. So solid lipid nanoparticle is the modern technology. We can, with the safe manner, we can develop nanoparticles. So we'll move to the objective first, to improve the bioavailability of hesperidine, because hesperidine is class 2 drug having limited aqueous solubility. In order to enhance the aqueous solubility by formulating aspirin, solid lipid nanoparticle we have made attempt to enhance the solubility. So these are the material we used: hesperidine, then stearic acid, cetosterol alcohol, 280 and dimethyl sulfur. This is the technology we use, that is homogenization technique, hot homogenization technique. These are the ingredients we have selected: stearic acid, lipid, cetosterol alcohol. Then surfactant is 280. Then drug is the hesperidine. So this is the various combination of the stearic acid and cetosterol alcohol we used in formulation, different formulations. So this is the technique we used. First we have melted the lipid at its melting point, and later on we stir it under constant stirring. We got the nano suspension first. We validated nano suspension. Then that emulsion we kept it for ultrasonation for a few minutes. Then we use the homogeneous high shear cooling centrifuge we use in order to get the colloidal emulsion. Once we got the colloidal emulsion, we gone for the freeze drying in order to study the further in order to perform the further characterization of the same. These are the different non-formulation we have prepared. The very first formulation we got some phase separation. So those emulsion we can consider for further study, which is stable only we have taken for lyophilization. These are the characterization of solid-lipid nanoparticle we have performed. We have performed the FTIR and we converted that of pure hesperidine. Then we have done the FPSCM, then stability study also. And development efficiency we compare after 90 days. There was no much change in the efficiency, that says that it's more stable method as compared to any other method. So come to the, we are not able to, due to lockdown, we are not able to complete our work. Still we have to do the drug release study with the same and the solubility study and all. Let me conclude my work now. Different methods currently has been used to enhance the bioavailability. We use development of solid lipid nano carrier in order to improve the bioavailability. Then we have performed the SRD temp analysis as well as so let me end with the slide. Come to the publication and collaboration. So I want to say one more message to all my students that it is not mandatory to we have well-equipped lab in order to perform in order to develop nanoparticle. We can do in your lab also, but you should have some collaboration with the other research institute in order to get characterization and all. We can't able to get it our college level, the institution level. So better we have collaboration with the other institutions. Then we can do the formulation work nicely in our lab. Then we can go for good publication in the impact factor of above 2 or 3. Okay, these are the some work we are done with the collaboration. Kaladhar sir, I want to acknowledge Kaladhar sir for his kind cooperation. Anupriya is the research scholar. So so this is the another work we published. Srilakshmi as well as Mithila were as research scholar. So let me thank all the participants for the patient listening. If you have any query, you can ask now.
Okay, so now the session is open for discussion. And those who have any queries related to the Deepa Madam session, you can have. So those participants in the Zoom platform, you can put it in the chat box. And those who are in the YouTube, you can put it in the top of your YouTube chat box. It will be represented to the speaker, right? So those who have any queries, please you can put it in the top of your chat box, and as well as in the top of your YouTube chat box also, in the Zoom as well as in the YouTube chat box, please. So there is a question from Syed Mohammed. So what is a folding endurance means, madam?
Folding endurance is nothing but it's a evaluation parameter of your transdermal patches. So while handling the patches, we should know that how effective that is work. So we'll be performing the folding endurance.
Thank you so much. There is a question, madam. What is the facilities we required to do as develop nanoparticles? Because we have some, there is a queries from the participants. So what are the facilities we require for that of you developing a nanoparticle, which is simple equipments? Can you please, madam?
See, I told you at the end of my session, this is not mandatory to have a well-equipped facility in your lab. You might be having magnetic stereo. Definitely magnetic stereo will be the, okay, in order to perform silver nanoparticle, magnetic stereo is more than sufficient. Suppose you want to do the solid lipid nanoparticle, but you should have a cooling centrifuge, ultra. Then you require mechanical stirrer. So whatever the available in your lab, you can use for the development. I told you now to get the characterization, that property only or to send the sample with collaboration with any other institution. Thank you for your.
Thank you so much, madam. And so there is a question from that. The drug from that of your Kalim Sheikh, the drug in the form of nanoparticle, how can it affect the patient body?
For this question, I have to take an example. For example, suppose you want to target the cancerogenious cell. Okay, if you want to target the cancerogenious cell with your nanoparticle, means directly we can't go with the nanoparticle. Okay, we need a nanocarriers, right? With the help of nanocarriers, maybe polymer, we have liposomes and solid lipid nanoparticle. So that carrier will help you to reach the moiety drug at the targeted site. Okay, I think it's clear.
Yes, thank you so much, madam. That is from the Karnar Reddy participants. In spite of several topics, what makes you to choose this topic for your research? What motivated you to do in the research actually?
That is a nice question. When I was doing UG as well as PG, I am very much interested to do the nanotechnology. At that time, I was thinking that I should require more facility in order to do this nanotechnology. So when I choose the career as academician, I got an opportunity to guide my B Pharm as well as M Pharm students. I have attended some seminars and webinars. So I got an idea that silver nanoparticle, especially from Astra University, I got an idea of silver nanoparticle is very feasible, eco-friendly method. I started my research with the silver nanoparticle. Thank you for your question.
Thank you, and thank you, madam. And there is another question from Gaurav Kole. How can release of the drug from the nanoparticle be controlled when used as a sustained or controlled release dosage forms?
For that only I told now, we need a nanocarrier. The nanocarrier will decide where to release the drug. Okay. So as in the case of conventional drug, we know that if you are taking the drug orally, it may be released at the end of the GIT according to your formulation, right? Whereas in the nanocarrier, we'll be giving all the nanoparticle in terms of maybe in injection, parenteral. So we can target easily in the targeted site.
Thank you so much, madam. And so there is another question from Rohan Patke. Which are reputed journal for nanoparticle publishing?
I have published one bioinformatics, colloidal bioinformatics. It having more than 3 impact factor. Okay. We have several journal like Journal of Controlled Drug Delivery System. The impact factor is high. If impact factor is high means they will be expecting some characterization. We are telling now nanoparticle. So all the characterization what we discussed so far, if you are able to do, definitely your paper would be reflected over there. You can publish in any reputed journal.
Thank you so much. There is a question from Ashwini Jadhav. how we'll find out the stability of the nano carrier? And once we got it, it's not stable after some days. What will be the next step we have to do?
This is a good question. Sometimes we'll be facing the same problem. Because these are nano size, right? So there's a chance for agglomeration of particle. But when in my personal experience, I'm telling that when you redisperse, when you upon shaking, you can redisperse easily.
Thank you so much. Okay, thank you so much, madam. And there are so many queries are there. So due to the time limit, just we would like to wind up the session. So Deepa madam has covered and share his experience in from that of your UG and PG and PhD projects, what he has done, and he's guided his projects. And he has had his own experience starting from that of your silver nanoparticles to that of your ceramic as well as solid lipid nanoparticles. And he has collaborated with the various researchers, and he has come out with that of good targeted over that of a cancer, ulcer, and microbial. So just he covered all the broad areas of that of your nanoparticulated drug delivery as a carriers, and how he shared his own experience in his lab as well as his collaborative lab. So I'm thankful. Thank you so much, madam. And I'm thankful in behalf of the Sydus Publishing and Kalinga Biomedical Research and Training Establishment, Odisha. On behalf of this both set of your organization, I'm very thankful for you for sharing your experience and enriching the knowledge and giving new ideas to that of you budding researchers. Thank you so much, madam. Thank you. Now the session is closed, second session, and we are going for the next one of that of your e-posters. Those of people are waiting for that of your e-poster sessions. Just a few minutes. Within few minutes, we'll start that of your e-poster session. Thank you so much, all of you. So all the participants, those who are in the platform, be ready with that. We are going to share the slides of the posters. I think both the evaluators are here. I think so. In the session, Dr. Balasubramanian sir, and also Dr. Shanmu Ratnam sir. I think so. So I just make to join that of your invite Dr. Shanmu Ratnam sir to join it. So there is a two evaluators are there. Once again, I want to repeat it and let you join. First of all, within few minutes, I'll tell that of your instruction to that of your e-poster presentation, and we'll start within 1 or 2 minutes. Thank you so much. Hello participants, just wait for a few minutes that one of the evaluator has to join. Immediately after the joining of the evaluator, we will start it actually. I think Dr. Balasubramanian sir is there, and just we are waiting for one more evaluator, Dr. Shanmuratnam. So immediately after the joining of the evaluator, we will start the session. Just 1 or 2 minutes. Sorry for the inconvenience.
Join. Welcome, sir.
Welcome, sir. Shanmuratnam, sir. Shanmuratnam, sir. Balu, sir.
Balu, sir.
Balu, sir.
Answer what
Balu, sir. Balu, sir.
Karthik, கேக்குதாப்பா?
Yeah.
Yes.
Okay. Fine. Thank you.
Karthikeyan, கேக்குதா?
கேக்குதுப்பா.
Okay.
Shanmuratnam, Balasubramanian, sir. Balasubramanian, sir.
Yes, I'm here.
Balasubramanian, sir.
Hello.
Yeah, yes, sir.
Okay, sir.
So we can start that, right?
Yeah, start.
Yeah, please, can you unmute yourself? And Shanmuratnam, sir, can you please unmute your video so we can see your presentation?
Okay. One moment.
Please.
Yeah.
Okay.
Are you able to see me?
Yes.
Welcome,
Okay.
sir.
Yeah.
So just all the participants, just we are going to start that of your e-poster session.
Definitely.
So we are just going to give the general instruction. So all the participants, there is a 2 evaluators are there. Dr. Balasubramanian, he is a professor and head Department of Pharmacology, Al-Shifa College of Pharmacy, Kerala, India. And Dr. Shanmuratnam, he is a Department of Pharmaceutics, Anna University, Trichy, Tamil Nadu, India. So these are the 2 evaluators for the e-poster sessions. So the general instruction, I want to just tell you the general instruction. There will be 5 minutes presentation time and 2 minutes a question session will be there, question or queries. So that participants are restricted to make that their presentation within 5 minutes. So we are going to share the presentation PPT from our side. Just you have to start presenting yourself, and after that any queries from that of your question. After presentation there will be questions from that of your both the evaluators, and after that the session will be over. Then we'll be going to that. So the poster presentation will be as per the order of the poster code. So those who are not presented the poster, they are not given the poster in advance, we'll be giving a chance in the last only. Don't interfere in between. So what are the poster I received till yesterday night, I'm going to share it now. I think 2 or 3 posters are pending. So just we are keep it in the pending. Only after completing all the posters from our side, then we are going to share, we'll allow to share from your side. So thank you. I welcome Dr. Balasubramanian sir as a poster evaluators of today's e-poster session, and also the Dr. Shanmuratnam sir to be the evaluators of today's session. I welcome both of you, sir, Dr. Balasubramanian sir as well as Dr. Shanmuratnam sir.
Thank you.
So I would like to start. I think all the poster presentees are there in the Zoom platform. I think so. Please, all of you be there. Please unmute yourself and you can start presenting. It should be audio as well as video should be unmuted. So I'm going to share that of your e-poster number 1 now. I request for both the evaluators, please note down that number. The post number 1 is just displayed here. Haripriya. Please, Haripriya is there. Please unmute yourself. We can start presenting it actually.
Hello, sir.
Yeah, please unmute
Can you
yourself first
hear?
of all. Please
Can you
unmute
hear
yourself.
me? Hello.
Yeah,
Can you hear
yeah.
me?
Please
Yeah.
Yeah, please.
Hello.
Please unmute
Hello.
your video
Hello
also,
all.
madam. Yeah, please.
Hello all. Good morning. Myself Haripriya. We four family graduates did a prospective 6-month study on the topic of antenatal
Yes, proceed.
on the topic of antenatal use of corticosteroids to prevent respiratory distress syndrome in preterm babies under the guidance of Dr. M.P. Narmada. And why did we select this project, or why did we select to this area, is because every year an estimated 50 million babies are born preterm. That is, 1 in 10 babies are preterm, and this number is rising. And approximately 1 million children die each year due to this complications of preterm birth. And in our case, in India, has the highest number of preterm births as well as neonatal deaths due to this prematurity. And the antenatal corticosteroid treatment for women who are at the risk of preterm delivery has emerged as the most effective intervention for the prevention of respiratory distress syndrome and reducing the neonatal morbidity and mortality. And in our study, our objective is to evaluate the incidence of RDS among the preterm infants in the study population and the association of antenatal corticosteroids to prevent the prevention of RDS in preterm babies, and the comparison of single dose and double dose of antenatal corticosteroids. And in our study population, all the live active infants are born before the 37 weeks are enrolled into our study. And out of 70 newborns we selected, 42 had been exposed to antenatal corticosteroids and 23 developed RDS. That is, 49% developed RDS. And that was and 20 newborns who had not been exposed to antenatal corticosteroids, 24 developed RDS. That is, 83% of newborns developed RDS. And this difference was statistically significant. And we compared the single dose and no steroid using out of 24 infants mother who exposed to single dose of antenatal corticosteroids, 15 developed RDS, and out of 24 whose mothers who not been exposed to steroids, 24 developed RDS. And this difference was not statistically significant. And we also compared this double dose of antenatal corticosteroids and no dose of antenatal corticosteroids. And 17 mothers who had been exposed to double dose of antenatal corticosteroids, only 8 developed RDS. And 28 mothers who had not been exposed to antenatal corticosteroids, 24 developed RDS. And this difference also was statistically significant. So what we concluded in our study is mainly there is a significant difference between the antenatal corticosteroids used and preventing the respiratory distress syndrome in preterm babies. And also we compared the single dose and double dose of antenatal corticosteroids, and there is also a significant difference between that. Thank you, sir.
Thank you so much. Can you, sir, evaluators, you can ask your questions, sir. Balasubramanian sir and Shanmurathanam sir can ask your questions. Sir, you are muted, sir. Balasubramanian sir, you are muted actually. Yeah, yes, sir. You can proceed.
Haripriya, are you hearing?
Yes, sir. Yes, sir. You can.
Okay, sir.
Yeah, proceed.
So which type? This is an observational. Which type? Prospective observational. 6 months study was conducted. How you can tell this is the prospective study?
From this August 2018 to
Yes, you continue.
Yes, madam. Haripriya, madam, you can proceed actually. Yeah.
Hello.
Yes, you can proceed, madam.
Hi, sir. Actually, 28 August to from that 2018 August to 6 months, we carried this study on the Department of Gynecology and Pediatrics in Pikeras Institute of Medical Science and Waldenad Hospital. We collided with 2 hospitals and did this study.
So you see here, you reported that all the prenatals are relevant to 1 month before this. Just 37 weeks, all 70 preterm babies. You included 70. You were yeah.
Actually, in our study, we selected between 24 weeks of gestation to 36 plus 7 weeks of gestation. That is 36 weeks plus 7 days of gestation. Like that, we selected. And all other babies, we have some exclusions also in our study. That is, in some babies had died due to the intrauterine fetal death or immediate expirations after this delivery, and also the presence of major any congenital abnormalities, and also in presence of any confirmed or suspected genetical malformations. All those are we excluded in our study. And what we included are the live active newborns born between this 24 to 36 to 1 to 6 weeks of gestation are included in our study, sir.
So what is the output of this on RDS? What you have observed? RDS?
Yes, sir.
Huh?
No, what is the output of RDS?
Actually, we got 82 preterm cases, sir. 82 to 85 preterm cases. But we can't access these numbers because some deliveries have not happened in our hospital because of some matters. And we can't access some materials also to access. So we selected 70 newborns. Out of the 70 newborns, 42 developed RDS.
In the single dose, how much you given?
Huh?
What is a single dose?
Single dose is actually a complete dose of corticosteroids is 12 mg. Actually, corticosteroids are mainly given as dexamethasones and betamethasones. And in case of betamethason, 12 mg betamethason, 24 hours apart, 2 doses are given. And in case of dexamethasone, 6 mg dexamethasone, 6 hours apart, 4 doses are mainly given. Why we mentioned the single dose means the patients, that is the mother only received a single 12 mg dose of betamethason.
Okay, but you said that this is commonly mentioned corticosteroids. It doesn't look nice. You have to show this if it is betamethason or what is the dose individually drug we should show. Generally, it doesn't look nice. No, you say corticosteroid. What we can interpret the result. Okay.
Okay, sir. Okay.
Thank you, sir, for your question. I think I invite that Shadmuratam sir to just ask the question, please.
Yeah, Haripriya, it's a good work. I would like to know only what is the output parameter and all you mentioned apart from this. Have you any output results of your various evaluation parameters? Do you have that one?
Please, sir, I didn't hear your question. Can you please repeat once more?
Yeah, you have here just you have compared, isn't it? Whether it's live on the condition is or not. So, what are the parameters you have taken to evaluate it?
Actually, our main three objective is these three, sir. And also, we evaluated some more cases like the number of deaths and the probability of attenuating this neonatal jaundice and coagulation. All these things are the complications of preterm, no? So we also calculated that also, but our main objective is these three things, so that we focus all in these things.
Okay. Yes, good. Okay.
Okay, sir.
This is post number 2. That is V. Nagalakshmi. V. Nagalakshmi, please come forward and you can present it actually.
Can you adjust the title? I'm not viewing title.
We can share a full screen. Karthikeyan, you can make it a full screen.
Yeah, just a minute, just a minute. How it is visible, sir?
Yeah.
Okay. So please, Nagalakshmi madam, Nagalakshmi madam.
Good afternoon, sir.
Please unmute yourself and video audio, please, you can come forward. Thank you.
Good afternoon, sir.
Yeah, please.
Yes, ma'am.
Sir, our aim is the study validate of Tegabin HCl using chromogenic reagents by spectrophotometer in bulk and pharmaceutical formulations. Tegabin HCl is an anticonvulsant drug used to help control some types of seizures in treatment of epilepsy. This is the structure of Tegabin HCl. Its molecular weight is 412 and its molecular formula is C20H25NO2S2 and HCl. And the appearance, it is white in color and it is white odorless and crystalline powder, and it is soluble in sparingly soluble in water and completely soluble in alkaline water. And for any drug, we have to we have to concentrate the functional groups. The functional groups are the active functional groups of the drug. In this Tegabin HCl, the actional functional groups are alkali carboxylic acid and tertiary nitrogen and sulfur groups. These are the three active functional groups in Tegabin HCl. A very few physicochemical methods appeared in the literature for the determination of Tegabin in pharmaceutical formulations using LCMS and HPCL. As the analytical important functional groups of Tegabin HCl were not fully exploited. Therefore, there is a lot of scope to develop the sensitive and flexible suitable spectrophotometric methods and HPLC methods. Based on the above feature, our team developed UV visible spectrophotometric methods. So we prepared a standard solution of 1 mg per ml of Tegabin HCl prepared by dissolving 100 mg in 100 ml with distilled water. This solution was further diluted with distilled water to obtain working standard solution of corresponding concentration to 200 micrograms per ml. Two methods we developed, sir. NBS-CB is the first method, and the second method is citric acid acetic anhydride method. NBS-CB method, redox reaction takes place. In this method, this is an indirect spectrophotometric method. Drug is reacted with NBS means N-bromosuccinimide and CB is celestine blue. First of all, the sample drug solution react with NBS. After that, the unreacted NBS react with CB. Then the celestine blue color decolorizes by forming light color, and in citric, the second method, citric acid, acetic acid, and acetic anhydride reagent, internal salt formation, violet color. Here the functional group tertiary nitrogen reacts with citric acid in presence of the acetic anhydride, forms internal salt, violet color develops. So for general method for general methodology, to develop a method, we have to follow some optimum conditions. We have to follow some, so there are so many factors that influence the sensitivity of the method. For example, the stability of the colored species, and also the nature of the solvent, temperature, and pH, and also addition of the reagents, the order of addition of reagents. These are the so many factors. By taking all these into consideration, we developed these two methods. Another thing is we have to choose the wavelength selection, lambda maximum, and we have to calibrate all these things by using validation parameters, and also the same procedure applied for pharmaceutical formulations. Also, Tegabine HL proprietary name is Gabitril, and its pharmacological concern name is Cadila, and its formulations are 2, 4, 6, 8, and 10 mg, and these are the absorption spectrum of method 1 and method 2. These are the ring bomb, I'm very sorry. These are the Beer-Lambert's law plots for method 1 and method 2. And results, these are the results. Optical spectroscopic results are lambda maximum, and Beer limits, and detection limits, and molar absorptivity, Sandel sensitivity. These are the methods for method 1 and method 2. These are the results of method 1, method 2. And we applied regression analysis, regression linear least square analysis. For this, we calculated the standard deviation on slope, standard deviation on intercept, intercept and slope, standard error, standard deviation in error, and also correlation coefficient. We calculated the percentage of relative standard deviations, 0.05 level, and in its confidence levels, 0.05 level and 0.01 level. So this is about the results we got. So from this, from these results, I want to conclude that the method 2 is more sensitive than method 1. So these two proposed methods are very simple, sensitive, and reliable, and can be used for the routine determination of tigerbine in bulk samples and pharmaceutical formulation, depending upon the need of the specific situations. Why we chosen this work is these spectrophotometric methods are very simple and reliable and economical. And another thing is we want to develop a method that is to be accessible in many labs. That's why we have chosen these two methods. Thank you, sir. Thank you, Vananda.
Okay, madam. It's good work, madam.
Yeah. So you can proceed the question, I think.
Yeah, it's good work, madam. I would like to know, so standard solution, drug solution you have prepared. How have you prepared? When you say in two words, standard, what solution you have used for preparation of standard drug solution? Preparing.
Standard, we have taken bulk sample, sir.
Okay.
Bulk sample. Then we prepared the standard drug solution. Then it is diluted to 200.
Yeah. How you dissolved with the drug, in what solution have you dissolved? What solvent you have used?
So it is sparingly soluble in water, sir. That's why we have add a small amount of base to it. Then it is soluble in distilled water, sir.
Okay, one second. So what is the BCS classification of your drug?
Sir?
Biopharmaceutical classification of your drug.
Biopharm, sir, I'm unable to understand.
Okay.
Can you please repeat?
Okay, it's a low soluble now. So whether it is low soluble in the sense whether it comes under class 2 or class 4.
I don't
know. Okay. What your lambda max have you used for max be fixed for your drug?
Lambda maximum for our drug is 520, sir.
520. So what range it could be? Visible range or UV range?
It is invisible range. We developed color species, sir.
Okay, you developed the color feature by adding the chromogenic.
Yes, sir.
Okay, ma'am. Okay, thank you.
Thank you. Thank you so much. I think due to some technical issue, I think sir will be, Dr. Balasubramanian sir will be joining. So, okay, thank you, madam. Thank you, Nagalakshmi madam, for your presentation. So, we are going to continue with the next presentee. Thank you. Thank you.
Thank you, sir. Thank you very much.
Sir, it is visible?
Yeah. Yes.
Tasni from College of Pharmaceutical Science, Trivandrum, Kerala.
Yes, sir.
Yeah, proceed.
Yeah, you can proceed actually. You can proceed.
Serial number is this one?
3.
Okay.
Good afternoon, ma'am.
Yeah, please. Can you please unmute your video also, madam? Please. Can you unmute your video?
Ma'am, your voice is getting breaking. Can you unmute your video?
Sir, I can unmute the video because my webcam didn't work.
Okay, just you proceed, madam. Proceed.
Good afternoon. The main aim of my review is to evaluate the novel therapeutic uses and applications of the capsaicin. The capsaicin is a naturally occurring alkaloid that's derived from chilies, and the capsaicin is responsible.
Karthikeyan sir, I could not able to hear.
Yeah, actually, please, Tasni madam, please, can you proceed? I think due to some technical issue, I think so, madam.
Okay.
We'll proceed for the next one. Madam, Tasni madam, are you there?
Yes.
Yeah, please proceed.
Me?
Yeah, proceed. Yeah.
Capsaicin is a naturally occurring alkaloid that is derived from chilies, and the capsaicin is responsible for its hot, pungent taste. And it's an alkaloid found in capsicum fruits of the family Solanaceae. Capsaicin is found in adequate amount in the placental tissues, and to a lesser extent in the seeds and pericarp portions of the capsicum. And structurally, the capsaicin belongs to a group of chemical known as vanilloids. The heat sensation of the capsaicin arises due to binding of the capsaicin to the transient receptor potential vanilloid subcategory, that is GRPV1. It is an ion channel receptor, and the capsaicin also is known as a modulator of GRPV1. This GRPV1 receptor responds to temperature, painful stimuli, acidosis, and osmolality. And the TRPV1 has a central role in thermal nociception and inflammatory hyperalgesia. A unique feature called the defunctionalization that is responsible for the capsaicin to use as a therapeutic capsaicin for its therapeutic use. And the capsaicin is proven to be beneficial in many physiological systems and can be used to treat diseases like pain, cancer, diabetes, obesity, infectious diseases, and other inflammatory diseases. The mechanism of action is that the binding of capsaicin to the TRPV1 receptor in small fiber sensory afferent nerve endings activate the receptor, and this leads to an influx of the calcium and release of inflammatory neuropeptides. This mediates the pungent property of the capsaicin and limits its tolerability. And the following the receptor activation, transient receptor activation, these neurons are functionally desensitized to further painful stimuli, and this leads to the analgesia. In addition, there may be degeneration of the nociceptive fibers also. And the clinical uses include pain, that is topically, it can be used for neuropathic pain and musculoskeletal pain disorder. It's a common form of chronic neuropathic pain following the head zoster. And the topical capsaicin was found effective in post-herpetic neuralgia. A randomized clinical trial
Yes, madam, we can proceed. Proceed, please.
for overactive, the capsaicin can also used for overactive bladder and detrusor hyperactivity. The capsaicin increases bladder capacity and reduces the adjunct incontinence in patients with neurogenic and non-neurogenic detrusor hyperactivity. The capsaicin is also useful for gastroprotection. That is, the stomach has a dense supply of TRPV1 bearing nerve fibers. The capsaicin causes vasodilation and increased mucosal blood flow. And this is mediated by nitric oxide and the GRP released by these TRPV1 bearing cells. And the capsaicin can also be used in pruritus, and it is postulated that the substance P, which is depleted by the capsaicin, is a mediator in the transmission of pruritus in renal failure. And the capsaicin can also be used in the treatment of beneficial. It is postulated in the. It is seen capsaicin has shown beneficial effect in cancer. The capsaicin altered the expression of several genes involved in cell survival. The capsaicin can induce cell cycle arrest or apoptosis or inhibit proliferation in a variety of cancer cells, suggesting that it has potent chemo-preventing activities. And it blocks the translocation of the nuclear factor kappa B and activator of the protein, activator protein 1 and signal transducer and activator of the transcription signaling pathway that are required for the cancerogenesis.
Okay, thank you so much, madam. We can, sir, you can proceed with the question actually.
Yeah, Tasni madam. Hello, Tasni madam. Can you say what do you mean by TRPV1?
Hello.
Yeah, can you say what do you mean by TRPV1?
The TRPV1 is the a vanillode receptor, that is the transient receptor, transient receptor potential vanillode receptor.
Okay, so you in the objective you evaluate the novel therapeutic uses. What is the novel therapeutic uses of this capsaicin?
The capsaicin can be given for site-specific anesthetic with the local anesthetic such as lidocaine, which cause the numbness and other side effect on their use.
Connecting
It
one
does not giving
wait.
site-specific
നെറ്റിന്റെ
anesthesia. And
പേജിൽ
the capsaicin can be used in some types of cancer.
Okay, ma'am. Okay, thank you.
ലാസ്റ്റ് ആയാലും കുഴപ്പമില്ല സമയമുണ്ട്.
Yes, sir. Thank you, sir. If you have any question, you can proceed, or we can go to the next one, sir.
We can go next. We can go next.
Yeah, yeah. Thank you, madam. Thank you, Tasni madam, for your presentation. Thank you.
Thank you, sir. Okay.
Sir, it is visible, right?
Yeah, yeah. Slightly.
Okay. Number 4, Bibin Jairaj, please. Number 4, Bibin Jairaj from College of Pharmaceutical Science, Trivandrum, Kerala.
Hello.
Yes.
Yeah, please. Yeah, please proceed. Unmute yourself first of all.
I just do it. Hello.
You can proceed. You can proceed.
The aim of this review is to summarize the outstanding progress that has been made by the phosphodiesterase inhibitors as anti-Alzheimer agents with encouraging results in the preclinical studies and also in the clinical trials. And you know that Alzheimer's disease is the most common form of dementia, which is affecting millions of people, millions of patients in the worldwide. And it is characterized by the progressive memory loss, a decline in the language skills, and accumulation of beta amyloid plaques, hyperphosphorylation of the tau protein. And the phosphodiesterase enzymes are those enzymes that hydrolyze the intracellular molecules, namely cyclic adenosine monophosphate, that is cyclic AMP, and cyclic guanosine monophosphate, that is CAMP. These are
പോസ്റ്റർ
produced in
ഉണ്ടായിരുന്നു
response to different
അതിന് വീഡിയോ ആക്കണമെന്നൊക്കെ പറഞ്ഞിട്ടുണ്ടായിരുന്നു പക്ഷെ വീഡിയോ ആക്കണമായിരുന്നു ഇതാണ് എൻ്റെ ഒരു ഫ്രണ്ട്
phosphodiesterase that have been used in
Bipin, unmute yourself and present, please. Unmute yourself. Yeah, please proceed.
Hello.
Yeah, proceed.
Okay. Then the molecule that target the phosphodiesterase has been used in various therapeutic applications beyond the erectile dysfunction. There's like antiplatelet effects, then COPD, chronic obstructive pulmonary diseases, chronic heart failure, psoriasis, and especially the Alzheimer's disease. Then here the use of phosphodiesterase is a non-amyloid based approaches, and we have knowledge of several phosphodiesterase having subfamilies, and these are highly expressed in human brain. And the inhibition of phosphodiesterase is involved in neurodegenerative process by regulating the concentration of cyclic AMP or cyclic GMP. That is the PDE inhibitors, the phosphodiesterase inhibitors, regulate neurodegenerative process by increasing the concentration of cyclic AMP or cyclic GMP in brain tissue. And the protein called CREB, that is a cyclic AMP responsive element binding protein. These are considered as the molecular switch that is required for the learning and memory. And several studies that demonstrated that if there is an imperfection or impaired CRED phosphorylation, that is will play an important role in the neurodegenerative disorder like especially Alzheimer's diseases. That is, the decreased level of cyclic AMP may cause a decreased concentration of CREB, which affect the transcription of genes, which is related to synaptic plasticity and the survival, and it results in the loss of synaptic plasticity or memory decline. The material and methods used as the animal models, that is Maurice Waterman, then passive avoidance and some objective recognition tasks. The result, that is inhibition of phosphodiesterase might have a promising effect on the improvement of the memory deficient in Alzheimer's disease. That is PDE inhibitors have been subjected to the clinical trials for the treatment of cognitive disorder in Alzheimer's patient, and the most of the inhibitors that is they are exhibiting outstanding safety and tolerability in phase 1 studies. And I conclude that the phosphodiesterase inhibitors will hydrolyze two important secondary messenger, that is cyclic AMP and cyclic GMP, and this can be used in the formation of before the formation of amyloid plaques or new fibrillary tangles, and by regulating the central nervous function like emotion, regulated learning, memory, and neuronal degeneration. And the inhibition of phosphodiesterase might have a better therapeutic effects on the Alzheimer's patients than the acetylcholine inhibitor. Thank you.
Yeah, good. So, Bipin, could you say that what are the commercial drugs available for phosphodiesterase inhibitors? Is there anything available?
Acetylcholine inhibitor or PDE.
Okay. So, have you collected only a few references, isn't it? So, you have any mechanism of action against this?
Sir, there is a protein called CRMP, cyclic AMP responsive element binding protein. These are this is a molecular switch for learning and memory. If there is a decline in the cyclic AMP level, then there will be a decreased concentration of CREB.
Okay. Okay. Good. Yeah. Karthi sir, we can move.
Yes, sir. Thank you. Thank you so much, Bipin Raj, for your presentation. Thank you.
Thank you. Thank you.
Sir, it is visible?
Yeah, yeah.
Yes. Yes, from Ashwadi RT from College of Pharmaceutical Science, Trivandrum, Kerala. Ashwadi from College of Pharmaceutical Science, Trivandrum, Kerala. Is Ashwadi is there in this Zoom platform? The meeting room, please. Ashwadi? Yes, Ashwadi RT, please, you can proceed actually. Ashwadi RT, you can proceed. Ashwadi RT, you can proceed actually. Hello, Ashwadi RT, madam. Actually, sir, there is there in the platform actually, maybe. Ashwadi RT, madam, please, you can proceed. Is it audible, right?
I think the friends are also available. Bipin Jairaj and Tashni also available.
Yeah, actually that only. Bipin Jairaj, please, you can please tell Ashwadi to proceed actually. We'll go into the topic next now. Due to time bound, we cannot wait for much. So we can go to the next one.
Note down.
So this is poster number 6 actually.
6, okay.
Poster number 6, clinical and toxicological studies of mock meat steeds. Anyone please? Who is the presentee of this poster, please? Sonali V. Sonali V. Number 6, post number 6. Okay, sir, we can go to the next one actually.
Yeah, yes.
I think it's visible, right, sir?
Yes, sir.
Yeah, next post number 7, 8, 7. They not submitted actually the poster.
Okay.
Yes, sir, I'm available, sir.
Yes. Sandeep, sir?
Yes, sir, I'm available.
Yeah, please proceed, sir.
Yeah, okay. So, shall I start, sir?
Yes, we can.
Okay. So, good afternoon, everyone. This is Sandeep from KBRITE Institute of Pharmaceutical Sciences, Guntur. And today I'm going to present my PhD thesis, the preparation and evaluation of febuxostat orodispersible tablets, which are prepared using Sterculia foda seed starch as an excipient. So coming to these orodispersible tablets, everyone know that they are also called as fast dissolving tablets. So these are nothing but the tablets when come in contact with the water, they disintegrate very rapidly, just within a matter of seconds, and they release the drug content. And for the main aim of this study is to prepare the orodispersible tablets of febuxostat, which is a BCS class 2 drug that is with poor aqueous solubility. The solubility of this drug can be enhanced by using the excipients. So here we call the excipients as super disintegrants. So what is a super disintegrant means? It actually increases the solubility of a drug by various mechanisms like wicking or swelling or etc. So we all know that we all having the artificial or the synthetic polymers. So instead of synthetic polymers, I want to try the natural polymer that is a natural carrier, Sterculia foetida seed starch. So here we have taken this Sterculia foetida seeds and we have extracted the starches from those seeds by using aqueous and alkali extraction procedures. So after these procedures, the starch was obtained and the yield of starch was nearly 10 to 12% for various methods. And using for this starch, we have performed phytochemical parameters as well as physicochemical parameters. The phytochemical parameters like presence of alkaloids, flavonoids, saponins, etc. All these studies were performed, and the starches have shown only the presence of polysaccharides, which is a very good sign that we can confirm only the starch is present apart from other things. And after that, these starches were subjected to physicochemical parameters. So whereas physicochemical parameters like gelatination temperature, pH, viscosity, swelling index, water absorption index, microbial growth, loss on drying, oxidizing substances, fluorescence, acidity, sulfated ash, and amylose content were estimated. And of all these, the starch which is extracted using the alkali which we have used here is sodium hydroxide. So 0.1% sodium hydroxide was used here. So that alkali extracted starch have shown better properties, better physicochemical properties. So how we can confirm that means with a swelling index of 79 and with a higher water absorption index of 294. So based on these parameters, the starch SFS2 was selected for preparation of further orodispersible tablets. And before moving on to that, we have performed the saturated solubility studies of ebuxostat to determine which dissolution medium has to be selected. And in this, the dissolution medium of phosphate pH 6 showed maximum solubility. So for this, we have also performed the calibration curve, which is also highly linear, with showing an R-square value of 0.999. So we have prepared orodispersible tablets of ebuxostat by using different concentrations of Sterculia foetida seed starch. So we have started from 2.5% of starch to 15%, that is from FS1 to FS6, and FP indicates the tablet which was prepared without any super disintegrant. And whereas for comparison, we have taken the standard CCS, cross caramelose sodium. It is most widely used to super disintegrate in case of fast dissolving tablets. And by using CCS, we have prepared FS7 to FS12 tablets. And after this, we have performed various pre-compression as well as post-compression parameters like angular free pore scars index, Hausner's ratio, weight uniformity, drug content. And because of the space issues, I couldn't show all those results over here. And I have shown directly the dissolution profiles. So dissolution profiles for tablets FS1 to FS12. Here you can see the blue line, it indicates the lowest one, that is the FP, which shows the pure drug couldn't dissolve or couldn't release more amount of drug. And the highest drug release was observed for the formulations FS6 and FS12. But these FX6 and FS12 were also showed only up to 89% of drug release, but not more than 90%. So for this reason, again, we have used the same composition and we have taken lyophilization technique. So lyophilization technique was performed by using a freeze dryer. And after this, again, the lyophilized powder was subjected to direct compression and tablets were made. And those formulations were labeled as FSL, FSL1 to FSL12. And among these, the FSL5 and FSL11 formulations prepared using 12.5% of SFS2 starch and 12.5% of CCS, they have showed maximum drug release. And for these optimized tablets of febuxostat, lyophilized febuxostat formulations, we have performed the characterization studies. The characterization studies like FTIR spectra, DSC thermograms, as well as SEM images, all these were performed. And the FTIR spectra showed similar peaks of pure drug excipients along with the combined formulations, whereas the DSC thermograms also showed a range of thermographic peaks, which showed that the drug and excipients doesn't have much interactions. Whereas the SEM images, you can see clearly over here, the febuxostat is in the crystalline form, and the starch which we have extracted, it is of clear spherical globular crystals. And when we have combined both these febuxostat along with the starch and the crystals, they were completely visible with each other. And clearly you can observe the crystallized form along with the starches. And finally, we have tested the accelerated sterility testings. The accelerated sterility testings were done for a period of 3 months and 6 months. Both the conditions were maintained, and before storage and after storage conditions also, we have performed the dissolution studies, which showed not much difference. Just very slight difference was observed, which shows the high stability of these prepared orodispersible tablets. So based on this, we can conclude that the Sterculia foetida seed starch, which we have extracted, it is having a very high super disintegrant property, and it can be easily used as an alternative for the normal artificial super disintegrants. And because of this, orodispersible tablets, ease of availability and ease of taking, patient compliance will also be increased, especially in case of geriatrics. So for them, it is highly advantageous. And as it is a natural source, we can also see easy availability as well as less side effects were observed. And thank you for giving me this opportunity.
Thank you, sir. And sir, you can proceed. Actually.
Yeah. So it's a very good work. I would like to know, so how you confirmed it only having polysaccharides? What test you have performed?
Yes, sir. We have performed the iodine test, sir. Iodine test showed the presence of blue color, sir. So we have confirmed it as a polysaccharide, sir.
So what are the time points you have taken for dissolution study?
Time points are 5, 10, 15, 20, 30.
So have you compared anything with commercial brands?
Yes, sir. Commercial brand also we have compared, sir. Only one formulation available from Dr. Reddy's laboratory, sir. So based on that, we have compared, and they have also used the CCS as super disintegrate in that.
So what is your hardness of your tablet when you are using a seed extracts?
Yes, sir. The hardness is 3.2, sir. 3.2 kgs.
Okay. So what is the quantity you have ordered? Minimum quantity and maximum quantity of your starch? Yes.
Sir, I couldn't get your question.
How much you ordered? What is the weight of your starch you incorporated?
Okay, the starch. Yes, sir. The minimum is 2.5%, sir. The maximum is 15% of the total weight of tablet.
Good. It's nice one. Good. Good.
Thank you. Sir, Balasubramanian, sir. Balasubramanian, sir. Dr. Balasubramanian, sir. Okay, sir. Thank you. Thank you, sir. Sandeep, sir. Thank you for your presentation. Is it visible? Sir,
yeah.
It is visible?
Yes.
Yeah, Ashwati is there. Ashwati RT.
Can I proceed?
Serial number? Serial number?
Serial number 5, sir, actually.
Okay.
Ashwati RT.
Hello, sir. Can I start?
Yeah, you can start. You can proceed, actually. Sir, note down, sir. Balasubramanian, sir, is 5. Post number 5, actually. Shanmuratnam, sir, it is post number 5. Okay, fine. Yes, ma'am, you can proceed. Yeah, you can proceed.
Yes, sir. Good afternoon. I am going to discuss about the topic advances in cancer immunotherapy. Immunotherapy has become an established pillar of cancer treatment, improving the prognosis of many patients with a broad variety of hematological and solid malignancies. The important types are chimeric antigen receptor T cells, checkpoint inhibitors, cancer vaccines, and oncolytic virus therapy. The aim of this review is to discuss the advances in cancer immunotherapy. The methods are, first one is chimeric antigen receptor T cell. It is a new form of immunotherapy that uses specially altered T cells to more specifically target cancer cells. The procedure include first we collect the WBC from the patient blood by using the procedure called a leukophage, then making the CAR T cell. That is, the T cells are separated and genetically altered by adding specific chimeric antigen receptor. Then receiving the CAR T cell infusion. Once the CAR T cells have been made, enough CAR T cells are made, then it is given back to the patient. And examples of this CAR T cell therapy, the drugs used are tisagenlecleucel, etc. Next is checkpoint inhibitors. The examples of checkpoint proteins like PD-L1, that is programmed cell death ligand 1, which is present on the tumor cell, and PD-1, which is present on the T cell, they help to keep the immune response in check. The binding of PD-L1 to PD-1 keeps T cells killing tumor cells in the body. Blocking this binding of PD-L1 to PD-1 with an immune checkpoint inhibitor, that is anti-PD-L1 or anti-PD-1, which allows T cell to kill the tumor cells. Examples for PD-1 inhibitors are nivolumab, semiprimab, etc. Then cancer vaccine. Some virus can also cause cancer, like human papillomavirus, hepatitis B virus, etc. These vaccines try to get the immune system to mount an attack against cancer cells in the body. Example, Sipuleucel T. Finally, we conclude that the immunotherapy is more advantages over chemotherapy because it can boost the immune response in the body as well as teach the immune system to how to identify and destroy cancer cells. So we can say that immunotherapy is a missing approach for future cancer therapy. Thank you, sir.
Yes, sir. Balu sir, you can proceed the question and followed by Shanmugaratnam sir.
Yeah, actually, this is a review, no?
Yes, sir. It is a review work.
Okay.
Yes, sir.
Yeah. So in T cells, in which T cells are interrupted with this? You have explained about the chimeric antigen receptor T cell. T cell, which type? Because there is a
CD cells are also and also present in the CD cells also.
So can you explain about the T cell, how it interrupt disturbed with the T cell signal pathways, T cells? Because this is what we can tell is so many cytokines are involved during this T cell. So
the main adverse effect associated with therapy is increased cytokine production. It's called cytokine syndrome. So during this therapy, we also give an chemotherapy before starting the CAR T cell therapy. Hello, sir.
Yes. So which type of cancers are specifically treated by using immunotherapy?
Many lung cancer also treated, leukemias. Hello?
So, yeah. No. You said that it is attached. This is mainly linked with the apoptosis process, right?
Yes, sir. Hello?
Yeah. Can you explain this apoptosis, in which it will how it can prevent the proliferation of the cells?
Sir, it activates B7 proteins also, which are associated with apoptosis. which activate these checkpoint inhibitors activate the apoptosis pathway. Hello?
Yeah, yeah.
Hello, sir.
So this is there any effect on the checkpoint?
Checkpoint
The
is
cycle
normally needed
checkpoint.
for the cell division. By blocking this pathway, we can promote the cell death. And these are also a kind useful for the cancer therapy. Hello?
Yes, yes.
Can you use these drugs as an immunosuppressant in the case of organ rejection processes?
Hello, sir.
These immunotherapy can be used as an immunosuppressant treatment ways. Can we use this this immunotherapy as an immunosuppressant?
I don't know, sir.
You don't have any idea about that. Okay, okay.
Okay, thank you, sir. I just asked a question from Shanmuratnam, sir. Sir, any questions from your side? Yeah, please.
Yeah, only thing is that you have mentioned method, no? So what do you mean by that one in case of cancer advances?
Sir?
So in methods, is there any new novel method or newer methods are available in immunotherapy cancer treatment?
CAR T cell is a newer method, sir. Clinical trials are for many clinical trials are on. Hello?
Yeah, yeah. Okay, okay. We can proceed.
Okay, sir. Thank you, Ashwati RT, for your presentation. Thank you.
Thank you, sir. Thank you.
Poster number 9. Okay. Mehis.
Hello.
Mehinas, please. Yeah.
Can you audible?
Yes.
Can I start?
Yes, you can proceed.
Okay. Good afternoon to everyone. My name is Mehnas M. Finally a BPharm from Department of Pharmaceutical Science, SME Pudupalli. First of all, thanking you for giving me this opportunity to present in front of you. My topic is computer-aided drug design and chemistry study of tolbutamide, which is an oral hypoglycemic agent. Computer-aided drug design, which plays a vital role in the pharmaceutical industry, which is mainly for the drug discovery, including development and designing of drug. These softwares is mainly based on the methods such as molecular modeling, structure-based design, structure-based virtual screening, ligand-based interaction. These softwares, which is characterized on working principles like Autodoc, Schrodinger, ChemSketch. Autodoc, which is a platform which for performing the docking of the ligand and a targeted molecules, whereas Schrodinger, which is used to perform, it is a molecular modeling software. This is here I'm using a ChemSketch, which is a molecular modeling program, which is used to create and modify the image of a chemical structure. And also we can display these chemical structures, 2D, 3D structures, a chemical bonding, etc. I have taken tolbutamide, which is an oral hypoglycemic agent, which is a sulfonyl urease containing a sulfonyl and urease group, which help in stimulating the secretion of insulin from beta cells. Here I have drawn the tolbutamide structure with different tools, which is present in this ChemSketch. There are different elements in the left hand side, and there are periodic tables, and by that there are different tools for Smiles notations, properties of that molecules to create. This is Smiles notation, which can be using Smiles notation. We can find the name of unknown compound, or which is similar to it. This is what the structure we have got. We can also obtain their properties like molecular formula weight, molar refraction, molar volume of a particular compound which we are studying. In this chem sketch itself, we have a PubChem and chem spider, so that we can determine the compound. Their name here I have taken tolutamide. You can also visualize various styles of represent 3D views like ball and stick model. Here I have shown the ball and stick model, and also there are fireframe, stick dot. There are different 3D visualizing representation. So as I concluded that this chemistry study of tolutamide is informative in understanding the structural properties of the compound, and also the 3D viewers help in visualizing the various styles of representation. Thank you.
Sir, Balu sir and Shanmantharam sir, you can proceed for the question, sir, actually.
Yeah, okay. So, Mahens, I would like to know, you have used tolutamide as such, isn't it? You didn't modify any structure, or you have not attached any SCR activity, isn't it?
No, sir.
Okay. So, does the chem sketch generates properties?
Sorry, sir.
So, you have drawn the structure and chem sketch using chem sketch, isn't it?
Yeah.
Yeah, whether that chem sketch, apart from this drawing alone, whether it doesn't produces any physicochemical parameters of your drug drawn structure?
Yeah, the molecular formula weight, molar volume can be determined.
Okay. But here in your results, you have shown you have extracted from the website, isn't it? The result segment.
No, I have from the software.
Which software?
ChemSketch.
ChemSketch. So what about this PubChem?
Sorry, sir.
Here in method you have mentioned PubChem, isn't it?
Yeah.
Now what is that use of that one?
Yeah. In ChemSketch itself, there is an icon called PubChem and ChemSpider.
Okay. So it will enter into the PubChem website and then it will extract the values, isn't it?
Yeah.
Okay. So you have drawn as such your drug, you have not modified any SCR related activities. Okay. Okay.
Oh, okay, sir. Let me continue.
Balu sir, you can proceed for the question.
I want to ask, you have used the hem sketch. Have you verified with the NMR?
So I was just a beginner, so.
Hello?
No, sir.
No, sir, they not proceeded immediately.
Okay.
Any other questions, sir?
No more.
Okay, thank you. Thank you, Hinas, for your presentation. Thank you so much.
Thank you.
Sir, it is visible?
Yes.
Yeah, it is, sir, both of you, that this is post number 11 actually.
11, okay.
Yeah, post number 11, Mohammed Afzal, College of Pharmaceutical Science, Government College, Trivandrum.
Yes, sir.
Mohammed Afzal is there?
Yes, sir. Hello.
Yeah, you can proceed. Unmute your video, audio, we can proceed.
Okay, what is this heading? I'm not seeing drugs used.
Sir, drugs used to alleviate the severity of symptoms of coronavirus.
Oh.
So this is my topic.
I'll read the drug used to alleviate the novel coronavirus infection.
Yes, sir. Severity of infection. To alleviate the severity of infection, sir. Hello?
Can you unmute your video?
Sir, due to some technical problem, my webcam is not.
Okay, proceed.
So, the mysterious coronavirus outbreak in the Chinese city Wuhan, now termed as COVID-19, and its fast spread to many other countries, endangered thousands of lives. This pandemic has catalyzed development of novel coronavirus vaccine across the biotech industry and in pharmaceutical company and other research organizations. So there are many drugs used in to treat the severity of this infection and the symptoms offered by this virus. So in which the main drugs is remdesivir, chloroquine, hydroxychloroquine. So we first go to the antiviral drugs. So the no drugs or biological have approved by the FDA for the treatment of COVID-19, even though the remdesivir gained emergency use authorization from the FDA on 1st May 2020, based on the preliminary data showing a faster time to recovery of hospitalization patient with severe disease. So these drugs, it formed to an active form that is adenosine nucleotide analog, interfere with the action of viral RNA-dependent RNA polymerase, and decrease the viral RNA production. So most of the patients are, many of the patients are tested with this drug to take their ability to suppress the corona infection. So the next one is dexamethasone. So most of the many of the countries they test the dexamethasone for the ventilator support. So as a corticoid medication used in allergy and asthma. So once these drug administered to bind to the receptor and form a complex to bigger molecule, it inhibits the enzyme phospholipase at A to N, block the process of inflammatory mediators. So see this randomized evaluation therapy from the Oxford University suggests that dexamethasone cuts the risk of death 1/3 in patient with ventilatory support and 1/5 of the patient with which require oxygen support. And this is the mainly used drug to reduce the severity of asthma attack offered by the symptoms of this virus. So next one is anti-inflammatory. So in 19 March 2020, FDA aware of the report and it states that NSAIDs such as ibuprofen could worsen the condition, which hypothesis that an enzyme that a biochemical reaction in the body is needed in the body could aggravate the COVID-19 symptoms. So the NSAID is not recommended use to alleviate the inflammatory response in this condition. So next is immune-based therapy. So in convalescent plasma therapy is the best method here. The SARS-CoV-2 antibody contained plasmas obtained from the recovered individual who had confirmed COVID-19 have been isolated by apheresis devices. So by this method, neutralizing antibody delivered with convalescent plasma can provide control on viral growth. So there is no serious adverse effect have been reported by use of this convalescent plasma therapy. And many evidence for the recovery of the patients are also available by this treatment method. So the main ADR reported or hypothesized by this method is infection with other causative agent like bacterial infection and immunological reaction and circulatory overload are the considered risk. So the next one is ACE inhibitor. So SARS-CoV-2 spike protein bind to the ACE2 receptor that cause the endocytosis of this virus into the host cell. So by inhibiting this ACE enzyme, this virus is not able to produce by binding this receptor, and it causes inability to endocytosis in the host cell. So these drugs can also be used. So the next one is the NLOCIPBS, an angiotensin receptor blocker to reduce the severity of acute lung injury and also vascular and myocardial remodeling in case of the infected patients. So the next one is amlodipine. Retrospective studies revealed that the calcium channel blockers aim to directly reduce the case fatality rate of the patient with hypertension. So the result from the study suggests calcium channel blocker administered for COVID-19 with hypertension as comorbidity with high improved disease outcome. So we go to the vaccines under clinical trials. So ZyCoV-D and Covaxin and ChAdOx1 and COVID-19. These are the mainly discussed vaccines worldwide. So first one, ZyCoV-1. This is India-based company Sydus Kerala has launched phase 2 clinical trial for this ZyCoV vaccine, which showed promise in the phase 1 study. In preclinical studies, also the vaccine given favorable safety, immunogenicity, and tolerability. Candidate was observed to induce high level of neutralizing antibody in animals. As for the company in phase 1 trial, found to be safe in healthy individual also. So next one is Covaxin. India's indigenous Covaxin, that is COVID-19 vaccine, which is produced by Bharat Biotech, which is developed in collaboration with ICMR and National Virology Institute. The indigenous inactivated vaccine is developed and maintained by the Bharat Biotech at biosafety 3 level and with high content facility. So this vaccine received DCG, the Drug Control General of India approval for phase 1 and phase 2 and human clinical trial for 2 across India from July 2020. So the next one is ChAdOx COVID-19. The Oxford COVID-19 clinical trial began in April 2020. The Lancet published that's the phase 2 clinical trial data says it did not lead to any unexpected reaction and had a broad neutralizing activity against COVID-19 in 100% of the participants. So we can expect this vaccine in market shortly. So next is my results, my conclusion. That is currently there is no approved drugs or vaccines available for testing or preventing COVID-19 infection. Even though the researchers around the world were working, testing, developing potential therapy for the COVID-19. In March, FDA recorded emergency use authorization on antimalarial drugs, hydroxychloroquine and chloroquine for the treatment of COVID-19 symptoms. In April 2020, researchers at the Oxford University initialized COVID-19 vaccine testing. Also in May 2020, FDA granted emergency use authorization for the investigation of antiviral drug remdesivir. And the several other studies also going on in this field to alleviate the symptoms of corona infection severity. So this is the graphical representation of the antiviral activity of the test drug against COVID-19 in vitro. Here it uses certain antiviral drugs like ribavirin, penciclovir, favipiravir, nafamosd, and some antimalarial drug like natazoxanide and hydroxychloroquine. So this is the an article published in Nature Cell Research. The standard assay were carried out to measure the effectiveness of this compound on the cytotoxicity and virus illness infection rate in, for this specific virus. So the cytotoxicity of the candidate compared with Vero E6 cells and determined by the CCK8 assay. So here the remdesivir shows steady inhibition within 0.1 concentration range, whereas the ribavirin it requires 10 micromolar concentration, and also the chloroquine 0.1 with less cytotoxic effect. So by this comparison with this study, we can conclude that remdesivir and hydroxychloroquine, which is most effective drug for treating these viral infection. So here the DMSO was used in control. This analysis showed the chloroquine is better even when compared with the remdesivir. So these are my results and the conclusion here. The clinical trials of the vaccine and other drugs have been fast-tracked and vaccines are expected to available in the end of 2020. So there are treatment that can alleviate the symptoms of coronavirus, such as difficulty in breathing and some certain other symptoms. To alleviate the symptoms, there are we can expect many drugs further. Thank you, sir.
So we can proceed for the questions, sir. Actually, Bala sir and
Afsal.
Sir.
You said that chloroquine, that means hydroxychloroquine is more better than the remdesivir. In which way?
So according to this in vitro analysis, they showed certain graphs according to their in vitro analysis. In that, it shows in case of remdesivir, it shows a steady inhibition within certain concentration range, that is 0.1 micromolar. When compared with hydroxychloroquine, which is better, than this remdesivir. And also the entry inhibition. In case of entry inhibition of the virus into the cell, the remdesivir is not possible to prevent this entry into the host cell, whereas in chloroquine, which is able to inhibit the entry also. So according to this study, I told this chloroquine is much more better.
Okay, good.
Yeah, you can move. We can move. No questions.
Sir, you can proceed with questions, sir.
Yeah, we can move. It's good. Okay.
Okay. Thank you. Thank you, Mohammed Afzal, for your presentation. Thank you so much.
Thank you, sir.
Sir, please note down that question number 14 it is. Simrana Fatima Yam, Sri Ramachandra Institute of Higher Education and Research, Deemed University, Chennai. Simrana Fatima Yam?
Yes, sir, I'm here.
Yeah, please. You can please unmute yourself and you can present.
Okay.
Sir, please note down that it is number 14. 14.
Okay.
Good afternoon, everyone. My topic today is comparative study of synthetic and natural super disintegrant on the formulation development of fast dissolving tablet containing macrolide antibiotic by direct compression technique. So in the olden days, we used to use the conventional dosage form because of the convenience, and only a single person can also be feasible for the taking of the tablet. But after that, because of the swallowing difficulty, the conventional dosage form has been changed into fast dissolving tablets. Fast dissolving tablets is nothing but oromils. In the mouth itself, it can be dissolved, or when come in contact with water, it will get dissolved easily. It can be given to geriatric, pediatric, or bedridden patients. Fast dissolving tablets are applicable for the local action in the mouth itself. Here my study is, I have taken two types of synthetic super disintegrant and one type of natural super disintegrant. The natural super disintegrant is the Plantago ovata seeds, that is from the Isapagol, and the synthetic super disintegrant is sodium starch glycolate and the cross caramelose sodium. I have compared these super and synthetic natural and synthetic super disintegrant, and came to the conclusion that natural super disintegrant is more effective than the synthetic. So I have taken this Plantago ovata mucilage. I have prepared this by taking the seeds of the Plantago ovata seeds, and in the distilled water, I have kept it for 48 hours, that is for 2 days. And then I have taken it to the boiling for 2 hours. The seeds, the mucilage from the seeds completely released into the water. And then after that, I have washed made it into a precipitate by washing it with 95% of ethyl alcohol. This process is done for 3 to 4 times, and then I have the precipitate is then dried for 50 in the hot air oven for 50 to 55 degrees Celsius, and then the mucilage is dried and powdered with a mortar and pestle, and then it is sieved in sieve number 100, and then it is taken it is kept in the desiccator for the further use. And then the fast dissolving tablet I have prepared by using this direct compression technique. I have taken the sodium starch glycolate and cross caramelose sodium and Plantago ovata in the ratio of 1:2:3. That is the ratio I have taken. And then I have taken microcrystalline cellulose. Microcrystalline cellulose acts as the bulking agent, and then sodium saccharin as a sweetener as it dissolves in the mouth. And then magnesium stearate acts as a lubricant, talc acts as a glidant, and aerosol as an anti-adherent. So I have I have done the pre-compression parameters. I have taken this pre-compression parameters results. I have done angle of repose, bulk density, tap density, and carriers index. In this, I have seen that the Plantago Veta seeds with a formulation of highest ratio, that is 30% of the ratio, gives the better results than compared to the other formulations. And then I have done that. I have manufactured the punched the tablet with the Remex tablet punching machine, and then forward it to the post compression parameters. In the post compression parameters, we can see that I have done the weight variation, hardness, friability, wetting time, disintegrating time, water absorption, and drug content test. And from this, I have come to the conclusion that the formulation with the highest ratio of Plantago Veta has got the better drug releasing content. And the stability studies has also, I have done the stability studies for 1 month, 2 months, and 3 months as well. And in that, the percentage of drug release in the 30% of the Plantago Veta seeds shows the better result. So from this, I have concluded that the natural super disintegrant is much more effective and has the better disintegrating property than the synthetic disintegrants. Thank you, sir.
Yes, sir, we can proceed for that question.
Yeah, okay. So have you shown your dissolution study here?
No, sir. Actually, I have shown the drug release study, sir.
Drug release and stability, okay, after stability studies.
Yes, sir.
Okay. So you mentioned, so synthetic superintendent is lesser than your natural superintendent. How?
Sir, I have done the drug release study, sir. In that, it shows that, I'm sorry, disintegration test also shows that the disintegration time within the, before 20 seconds itself, my, this Plantago Veta seeds have been, the drug containing the Plantago Veta that disintegrates faster than the other synthetic super disintegrants, sir.
What is your total weight of your tablet?
Total weight is 350 mg, sir.
Why you have chosen macrolide antibiotic for this study? For this study, why you have chosen macrolide antibiotics?
Because it is easily available, sir, and macrolide antibiotics have better results they show, sir, in the.
So what, in case of quantification, what method you have adopted for your macrolide antibiotic?
Sir, I don't get you.
In case of your dissolution study or drug content, what instrument you have used to quantify your azithromycin? You have mentioned azithromycin, isn't it?
Yes, sir, azithromycin.
So what instrument you have used to quantify azithromycin?
Sir, I couldn't get you what you're asking.
Whether you have used any spectrophotometric method to quantify?
No, spectrophotometric method I have used, sir.
UV or HPLC?
UV, sir.
UV. So what lambda max you have used?
317 nm, sir.
Okay, so is there any established procedure available in 317?
Sir?
Is there any already methods are available for a macrolide antibiotic in UV quantification?
Yes, sir.
Okay. Okay. Sir?
Thank you.
So, Bala sir, you can proceed with the question.
Fatima, do you know about the azithromycin formulations in which type of tablets are available currently? Azithromycin. Azithromycin, which form of, whether it is an entry-coated form or in which forms are available in market? Azithromycin. Azithromycin.
It's available in entry-coated form, sir. I'm sorry.
Entry-coated azithromycin, like erythromycin form. So then,
no, sir, it's not entry-coated, sir. Sorry.
Then why you went to evaluate it the fasting dissolution? Why we need azithromycin? Because if azithromycin, you see we should check about the peak plasma level of the azithromycin. Or have you checked the bioavailability?
Yes, sir, it's 37%.
Bioavailability verified. But you have mentioned is only the evaluation of these physical properties. evaluation, tablet formulation evaluation?
Sir, bioavailability is not verified, sir, actually, but for from the
That is
previous
a very
study, I have
important.
come to
That thing is very important. Otherwise, this macrolide antibiotic, we have to check it, right? So already
Yes,
it crosses the gastric station, and also we have to check the bioavailability of this azithromycin. So
yes,
whenever you are going to improve the formulation, first thing is what for we are taking this drug, what is available, if you use which is better than this, what that is very important. If there is any advantages which you are doing than that of the previous available formulation, that is very important, isn't it?
yes, sir.
The work is good, but in what purpose you are using azithromycin as a highly soluble matter in this? Okay, thank you.
Okay, thank you, Sabrana Fatima, for your presentation.
Thank you,
Thank you so much.
Excuse me, sir. My poster number is 6. Can I proceed for the poster presentation?
Karthikeyan, not audible, sir. Your voice is not audible. Karthikeyan, sir. Karthikeyan, sir, your voice is not audible.
So all of you, please wait the poster. After the completion of that, we will just make it. Okay. Now, I think I call Anaga Surendran to present it.
And the screen is going.
So please note down that number is post number 15 actually.
Karthikeyan, sir, the screen is from different person, it seems.
Just a minute. Now it is okay, sir?
No, it's coming clinical and toxicology studies of moonbeam seeds.
Just a minute, sir, please.
Oh, okay.
Now?
No, I think someone has pinned it, it seems. Now your screen is visible. Now your face is visible.
No, I'll just tell you.
Okay.
Now, sir?
Yeah.
Now, sir?
Yes. The liposome.
Yeah. The liposome has smart nanocarriers and its smartness for the tumor targeting.
Poster number 15.
Yeah. So just post number 15, sir. Balu sir and
Yeah.
Anaga madam.
Yeah, sir.
Yeah, please proceed. You can proceed.
Good afternoon, sir. My name is Anaga Sudindran. I am a B.Pharm final year student at Ahilya School of Pharmacy, Palakkad, Kerala. My poster topic is the lymphosome as a smart nanocarriers and its smartness in tumor targeting. First of all, the nanocharacters is a wonder of modern science that play vital roles in biomedical applications, especially in anti-cancer drug delivery. To enquire the limitations associated with conventional drug delivery system, smart nanocarrier-based drug delivery systems have been developed, also known as smart drug delivery system. Nanocarriers are liposomes, mesocells, and dendrites, spines, and scondum dots, etc. Hello, sir.
Yeah.
Hello.
Yes, you can proceed, ma'am.
Sir. Golden nanoparticle and etc. Some nanoparticles are organic nanoparticles and inorganic nanoparticles. Contondons and spinoids and inorganic nanoparticles. Other others are organic nanoparticles. The main advantages of nanoparticles are to protect drug from being degraded in body before they reach their target, then to enhance the absorption of drug into tumor, and to prevent the drug from interacting with normal cells, thus avoiding the side effects. Hello, sir.
Yes, you please proceed.
Hello.
Yes, ma'am, you can
You
proceed.
can proceed.
Continue.
Yes, you can proceed. Anaka madam, you can proceed actually.
Sorry.
Hello, sir.
Yes, proceed.
Okay, sir. The lymphosomes are actually have the therapeutical and diagnostic applications. So it is a nanocarrier. How we working the nanocarrier as a smart means its smartness is doing by functional modification. We are doing functional modifications at attaching the ligands and easily identify the defective cell and release the medicaments. Then other one is we are attaching the natural enzymes. The cell will absorb and give infrared radiation.
Yes, proceed, madam.
After the giving infrared radiation, will be released the photochemical materials. The soil cells are targeting, and here two approaches, active and passive tagging, or passive or active stimuli. Active stimuli is pH, enzymes, and etc. These are passive stimulants, and active stimulants means temperature, then magnetic, light, etc.
Yes, proceed. You're not audible, right? Yes, Anaka, madam, please proceed. Anaka, madam. Anaka, madam. Anaka, madam. Okay. So we'll give one more chance. Just we'll proceed for the next one.
Okay. Yes, she's back, it seems.
Anaka?
Hello, sir. Hello.
Yeah, please.
Hello, sir.
Proceed. You can proceed now.
Sir, it is visible?
Not yet.
No, sir.
Now?
No.
Yes.
Yes, sir.
Yes, please. Yeah, proceed.
May I continue, sir?
Yes, please.
You just continue.
Okay, sir. The beneficial properties targeted nanoparticles or nanocarriers, biocompatibility, non-toxic and physicochemical stable, and then minimum drug leakage, then biodegradable carrier, increased treatment efficacy, reduced adverse effects, and controlled biodistribution, reduced dose required. Then
You can proceed to the conclusion, madam, please, first.
Sir.
Yeah.
There's all nanocharacters are targeting on drug moiety, but in our poster presentation, we are focused on liposome. Then we are concluding that describe the types of commonly used nanocarriers in tumor treatment, and give a special emphasis on the smartness of liposome in for tumor targeted delivery and controlled release of drugs. The current field of liposomes focus on the both therapeutic and diagnostic applications. This review helps to understand the research about recent advance in liposome research in the tumor targeting and insight new ideas to develop more effective tumor therapy. Thank you, sir.
Okay, thank you. Thank you. Sir, you can proceed for the question.
Yeah, good. So could you say anything about diagnostics of your applications with related to the liposome?
What's that?
And diagnostic applications of liposome. So how it helps in diagnostic applications, your liposome? Okay, could you say anything about stealth liposome?
Sir?
Stealth liposomes. Do you know anything about that one? Stealth liposomes? Okay. Okay. Sir?
Bali sir, you can proceed. Bali sir.
Anaka, can you tell me any other nanocarriers other than the liposome? Other than the liposome, you said that the liposome is a nanocarrier that you are talking now. Any other nanocarriers?
Hello, sir. Couldn't get my
Nanocarriers other than the liposome. Okay, what is the size of the liposome? Other
Hello,
the polymers.
Sir. Hello, sir.
Polymer. What is the size of the liposome? Size of the liposome.
0.025 micrometer to 2.5. Hello, sir.
Then what about these nanoparticles?
Sir?
Nanoparticle size? Okay, ma. Okay. Thank you.
Okay. Thank you, Anika, for your presentation. Thank you, sir. Visible? It is visible?
Yes.
Yes, sir. Actually, it is post number 16, sir. Actually.
16. Okay, sir.
16. Deshna DS from JDT Islam College of Pharmacy, Kerala. Deshna, madam.
Hello.
Yes, madam. Please proceed.
Is it audible?
Yes, it's audible. You can proceed.
Okay, thank you. So the topic of my presentation is a review on synthesis of novel heterocyclic derivatives of chalcone, which act as a potent pharmacologically active molecule. And about chalcone is an aromatic ketone and an enone that forms a central core for a variety of biologically important compounds. And this can be otherwise known in other names like benzylidene acetophenone, benzyl acetophenone, etc. And the main aim or the objective of my study to analyze and to study the various pharmacological activities of chalcones and the synthesis, the different synthesis that is already reported, and to design a new molecule with potent activity. That is the objective of the study. And the method that I'm going to adopt for this study is an in silico designing of chalcone derivatives. That is, I have to prepare a library of different chalcone derivatives by using the different molecule. The general method for the synthesis of this chalcone is by using that is benzaldehyde and acetophenone. that is a condensation reaction, that is aldol condensation reaction, by using sodium hydroxide which act as catalyst. And by using this aldehyde or different libraries of chalcone derivatives has to be prepared, and I have to screen for the in silico designing. And first I have to convert this 2D structure of this libraries into 3D structure and the virtual screening for the biological data prediction. And then the PDB, the correct or the apt PDB ID has to be chosen from PDB data. And that is the protein structure, and the protein, the correct protein structure has to be retrieved and it has to be prepared for the docking. So it is an in silico method. So, and after the preparation of protein, it has to be docked for the biological or the to see the score. And the best score compound has to be synthesized and has to be evaluated for the biological activity. And this is what my method is going to be adopting. Okay, and why I have chosen this chalcone derivative is chalcone has got the that is the chalcone and the derivatives has demonstrated a wide range of biological activities. And also the method of synthesis, it is relatively easy method of synthesis when compared to other. And the main aim, that is the aim of my study, is to synthesize the new chalcone derivatives. I have already told the potent activity. The thrust area of my study is an anti-diabetic, to develop an anti-diabetic chalcone. For that, I have to, I have seen or analyzed so many articles, and it is found that chalcones have reported anti-diabetic activity, and my aim is to develop an anti-diabetic chalcone. And that is why I have selected this chalcone, and this is what my presentation is. Thank you.
Okay. So, madam, you mentioned you are going for anti-diabetic activity, isn't it?
Yes, sir. Anti-diabetic activity.
In your introduction part, you have not included that word itself.
Yes, sir. Yes, sir. I have seen it. That was
okay. So, what docking software you are going to use?
It's a software.
Software
For in silico screen, that is a conversion of 2D structure to 3D structure. I'll be using Sketch or ChemDraw like that, and others I'll be using the Autodoc tools.
So
and for virtual screening, Discovery Studio, Open Babel, Swiss ADME for biological prediction, all those things.
Discovery Studio you have?
Sir?
Do you have Discovery Studio with you?
Yeah, I'm having. That is a academic version I'm having.
Okay. So the methodology, everything is aim only. Here you have shown only aim only, isn't it?
Yes, sir. Okay. It's actually a review article, and this is a review presentation.
Okay, ma'am.
Okay. Thank you.
Bali sir, please proceed.
It is say this is a review, but you modified this presentation as a research wise, something you methodology aim you have given, and accordingly I thought that this work you have done somewhere. So you didn't do anything. This is a review only, right?
Yes, sir, only review. This is only a review.
And okay, you are planning to do this work.
Yeah. Yes, sir.
Charcone derivatives. Charcone derivatives.
Yes, sir.
Is there any proof? You have any previously reported charcone oriented?
Yes.
Any
yes, sir.
How how you can see charcone itself possess any anti-diabetic activity?
No, sir. When it is combined with some other heterocyclics like pyrazolines and all, that possess anti-diabetic activity. Actually, my study is to that is another PPAR gamma receptor study. That is my aim. PPAR gamma study. So I have found that some of the chalcone derivatives, when it is compared with the pyrazoline, it acts on another alternative binding site of this PPAR gamma, and that produces that has a promising anti-diabetic activity by sensitizing insulin secretion. So that is what my aim is to be. So far, I haven't started anything. I am planning.
So you have a plan to modify this Salcon to
Yeah.
what is that peroxide proliferator related receptor?
Yes, sir. Peroxisome proliferated activating receptor gamma.
Okay.
And not on actually not on that receptor. There is an alternative site near the omega loop. There it will go and bind.
Okay, that's fine. Okay.
Thank you so much, madam, for presentation. Thank you.
Thank you.
This is 16, no?
Yes, sir, 16. Yeah, another posters are 2-3 posters are there. I'll pass up, please, just to make it. Is it visible, sir?
Yeah, yes.
Yes, sir, it is visible.
I want the title. So the title is blocking some with this clinical
And toxicological studies of mung bean seeds.
Post number 6.
Post number 6 actually.
Okay. Post number 6, no.
Sonali madam is there? Sonali madam is there? Sonali madam? Sonali madam?
Posted 10.
Yes. Sonali madam? Just a minute, sir. They are joining now. Please minute. Just a minute.
Okay.
Sonali madam? Sonali madam? Sonali madam? Sonali madam?
Hello, sir.
Yeah, proceed.
Sir, I'm audible.
Yeah, proceed.
Okay, sir. Good afternoon, sir. Myself Sonali Uppalwar. I'm student from the Judy Goenka University, and I'm presenting paper on topic clinical and toxicological studies of mung bean studies. The mung bean seed that is a traditional food, and in all over India, that food that is a used food as well as a food, and for the making the traditional type of the diseases. So that food that is a very useful, and that mung beans that is a useful for treating the several types of the diseases, like it is used as an in the disease of the diabetes, in the disease of the hypertension, in the disease of the cancer, and in case of the piles, and in case of the rheumatic arthritis, as well as to increase the muscular tonicity, to increase the memory. So it is that food that seed having the very beneficial effect on the human body. So here is a need to do studies on the clinical and toxicological studies of the mung bean seeds. So clinical studies that is basically related to the study of the drugs on the human being. So in this study, there is a basically study of the what is the effect of the mung bean seeds on the human being, and the toxicological studies. In that case, there is a study of the toxicity of the mung bean seeds on the human being. So this is a review article, and this review articles I have mentioned the different types of the actions of the mung bean seeds on human bodies, and as well as in this article I have mentioned the toxicological effect of the mung bean seeds. So basically, the mung bean seed doesn't show any toxicological effect, but when in the case of the seedling, when it is administered, the heavy metals, for example, arsenic, lead, chromium, that will be affect on most of that the seedling. So as far as the toxicity is concerned, so moonbeam seed doesn't have any type of the toxicity, but in the case of the seedling or in the case of the plantation, and if there is a there is a supply of the heavy metals, so then definitely there is a effect on their plant growth, on their effect of the photosynthesis, and the effect of the bioactive plant constituents. So the moonbeam having the various and types of the bioactive compounds that is useful for the treating the various types of the diseases. So in this case, there is a need to study the different type of the chemicals and what is the effect of that chemical on the human body. So the clinical studies shows that the moonbeam seed is useful to increase the muscular tonicity, as well as this seed that trial are performed on the human being in the different countries. For example, America, Africa, that studies, that clinical trials that have been performed, and the conclusion is that moonbeam seed is having the tremendous pharmacological activity, and it has shown the beneficial pharmacological effect in the human being trial, and it is a use and it is a given to the children also, and shows that the children's health improve, children's memory is improved. So the government of the America decided it is used as a food. It should give as a food tonic to the small children. So it is a very useful to the small children also, and it is also useful for the adults to increase the memory, to increase the muscular tonicity, as well as it is also useful in the diabetes, in blood pressure, and in case of the pile treatment. So the conclusion is that moonbeam seed having the very good pharmacological effect on the human being, as well as it is don't have any toxicological effect. But when it is given to the seedling process, then definitely affect on the moonbeam plant, on their growth, as well as on their chemical constituents. Thank you.
Okay, sir, we can proceed for the questions, sir. Actually, question session.
Sonali, this moonbeam is this. What is that? A small plant? Whether it is a shrub or herb or which type?
It is a shrub type of the plant.
Moonbeam. That seeds means what? It is in the fruit form or which one?
It is a fruit form, sir.
Fruit. So traditionally, traditionally these seeds are used for this purpose for anti-hypertension or anti-diabetes.
Yeah. Traditionally it is used as a food, and it is also useful for the making the various types of the diseases. But it's having the various types of the pharmacological actions, that is anti-diabetic, anti-hypertension, anti-cancer. It is also useful to increase the muscular tonicity, and it is also useful to increase the memory power. So it has, and this is mentioned into the ancient books.
So this is one review you are showing that this possesses this type of pharmacological, but it scientifically that is not proved, isn't it?
Yes, sir, it is a proof that it is a lot of literature. I have doing the PhD on this topic, and there is mentioned the lots of journals. They have mentioned the anti-cancer activity, lots of work on the anti-cancer activities. It is also useful in all types of the cancer, and it is shows the remarkable reductions of the tumor growth. So it is also studied the hypertension activity. Also, it has that also proves that have the pharmacological activity, and that also the proof. It has the anti-hypertensive activity, and it is also proved. So, but there is a less literature on the clinical studies. Means there is a less studies on the human being. So less literature in case of the clinical studies of the moon insects.
You worked
Thank you,
with this
sir.
plant?
You can, yeah.
Yes, sir. I have worked with this plant and I'm doing the work with this plant.
You're using this one. Okay. Then why you are telling that there is a lack of toxicological effect or something?
Yeah. Yes, sir. Please repeat. Hello.
No. You are working with this plant.
Yes, sir. I'm working this plant.
But already this study was carried out in human being also. As a
Less studies have been carried out in this. There is a muscular.
What is your work with this plant?
I work with this plant, the extraction and isolation of the active bioactive compounds which are related to the memory enhancer process.
Okay, sir.
Thank you. Thank you so much. Sir, any other question or you can proceed further?
No, we can proceed further.
Okay, thank you. Thank you so much, madam. Sonali, madam, thank you so much.
Thank you.
Yes, post number 12. If you have, you can present now. Post number 12.
Yes, sir.
Yeah, just you can share your poster, please. Actually, we didn't receive your poster yesterday till now.
But I couldn't share my screen, sir.
Why? I'll check it anyway.
Can you send it to mail now?
I'll check it anyway, please. You send it?
Have you sent to mail?
abutweb@gmail.com.
What's the number actually? What's the name?
12. Sandhya, yes, sir.
But I didn't receive actually.
Can you send it now?
Which one actually?
Salivary biomarkers from.
But we didn't receive it actually. That's the problem. We'll check it in. Can you share it now?
But
what are the posters we received? Yeah, what are the posters we received? We ordered actually.
Can I send it now, sir?
Yeah, you please send it.
It's a mail ID.
Mail ID, you know now. Submit paper at right?
Okay, sir.
Please send it now. Fast.
Anyone else? 10?
Anyone post number? This is 10 or 12? Huh?
12.
Post number 10 is there? 10?
Yes, sir.
Yeah, can you please share your slide?
I sent you.
We didn't receive your slide actually. That's.
Could you tell me the email ID? I will send them.
See, yesterday all the thing we have mailed everything, and only you people having the problem actually. No problem, we'll send it actually. That submit paper you already share in that group. You can see that actually.
Yeah.
Submit paper.
I sent them.
Please send it now. Please send it now. Please send it now. Please. Submit conference papers @gmail.com.
I have sent, please.
I am sharing that in the chat box, please. I'm sharing that in the chat box.
This is Ghanshyam, poster number 10. I have sent just now my posters.
Please, I'll check it anyway. Yes, I received it actually. I'll make it.
10 only, no? 10.
Yes, post number 10. I received it actually. You can present now actually. Yeah, sir, it is visible, right? Balu
Yes.
sir and Chanmatram sir.
Yes, yes.
Yeah, you can proceed actually. Post number 10, sir, actually.
10, okay.
Post number 10. Yes, please.
So hi, good afternoon. This is Ghanshyam Mali. This is one of my PhD work. The title of this abstract is glucagon-like peptide-1 analogs and thyroid cancer, an analysis of spontaneous cases reported in European pharmacovigilance database. Coming to introduction, the use of GLP-1 analogs have been linked with the risk of thyroid cancer. Adverse drug reaction cannot be easily detected in studies conducted before a drug reaches the market. Spontaneous reporting systems have been used as a crucial method for post-marketing drug safety surveillance. The European Ultravigilance database has a very large population coverage. It covers both European and non-European countries, which is important when investigating very rare events such as thyroid cancer. The objective of our study was to detect from ultravigilance database, that is European pharmacovigilance database, that is ultravigilance, a safety signal for thyroid cancer with GLP-1 analogs. Coming to method section, we requested European Medicine Agency, that is EMA, all reports of thyroid cancers reported with GLP-1 analogs in EV database from their inception till 30th January 2020. So the cases were identified with medical dictionary for regulatory activity, that is MEDRA version 22.1. We perform a case non-case analysis to detect the association that calculated proportional reporting ratio PRR, and their 95% confidence interval is a measure of this proportionality. So this method is used to detect safety signals in large pharmacovigilance databases. In ultravigilance database, to generate a safety signal, which is information on a new or non-adverse event that is potentially caused by a drug, the lower bound of 95% confidence interval of the PRR is required to be more than equal to 1, and the number of individual cases to be more than 3. Coming to result section, there were 11,243 cases of thyroid cancer and related preferred terms in total of 66,65,794 reports recorded in ultravigilance database during the study period. So GLP-1 analogs were involved in total of 236 cases. The association was strongest for liraglutide with 113 cases, followed by exenatide 76 cases and dulaglutide 35 cases. From the table, we can see that all the GLP-1 analogs are involved in some of the cases report with thyroid cancer. Like albiglutide, there are 3 cases. Dulaglutide, there are 35 cases. Exenatide, there are 76 cases. With liraglutide, most number of cases are there, that is 130. With semaglutide, 9 cases were there. So coming to discussion and conclusion section, from this study, we showed that disproportionality is reported for GLP-1 analog and thyroid cancer. And from this study, we found that spontaneous reports with GLP-1 analogs are associated with thyroid cancer in patients with type 2 diabetes mellitus. That's all, sir.
Sir, you can proceed for questions, sir, please. Firstly.
So you have used only one database, isn't it?
Yeah. That is
so European. So is there any other databases for this pharmacovigilance?
Yeah, there is one more database from reputed regulatory agency, that is US FDA. But mostly what happens, the reports are common in US FDA database and European database. That's why we have chosen one database, that is European.
Okay, so is there any country specific in European also?
This is actually, this database involves all worldwide reports of spontaneous reports, including European countries as well as non-European countries.
Okay. So this is meta-analysis, meta-research analysis, isn't it?
So this is not meta-analysis, this is retrospective study of spontaneous cases.
Okay. So at the end, you have mentioned in patients with type 2 diabetes, isn't it?
Sorry?
In the end of your conclusion, you have mentioned patients with type 2 diabetes.
Yes, sir.
So what is the significance in that?
GLP-1 analogs are indicated in the type 2 diabetes. So we have chosen GLP-1 analog. That is these 5 drugs: elbiglutide, dulaglutide, exenatide, liraglutide, and semaglutide. So these drugs are involved in type 2 diabetes treatment, injectable anti-diabetic.
Okay.
So
Okay.
these drugs are associated with thyroid cancer.
Okay. Okay, sir.
Sir, you have any questions, sir? Bala sir, you can proceed. Bala sir.
No, I have a doubt. This Mali, I think you have presented already the same thing, glucocorticoid in the last.
Earlier it was, that was of pancreatic cancer.
Pancreatic, huh? Okay.
Yeah. This time this is thyroid cancer. These all are my PhD research work.
Okay, thank you. Thank you so much for your presentation. Thank you. The last one more presentation is there, sir. Please, all of you are requested to be there and patient. Yes, sir. The last poster we received. Just a minute, sir. I'll.
Okay.
Sir, the last poster actually. Poster number 12 actually. It is visible, right?
Yes, sir.
Yeah, please.
Salivary biomarkers.
Yeah.
Okay.
Madam, you can present actually. Sandhya, madam.
Yes, sir.
Yeah, you can proceed.
Okay, sir. Thank you. Good afternoon, one and all. I welcome to my e-poster presentation on the topic salivary biomarkers and proteomics for diagnostic and clinical utilities, a review. Hereby, we try to evaluate the role of saliva omics for identifying the biomarkers and exploring the role of saliva in the diagnosis of disease. And we all know that saliva is an exocrine secretion that is produced from the salivary glands. And there are numerous functions for saliva in the oral cavity, which include cleansing action, protection, etc. Apart from this, it also have antimicrobial effects, and it also helps in digestion. Nowadays, the field of saliva omics is developing so fast, that is, saliva can be well accepted as the biological markers. Proteomic platforms that have analyzed that the human salivary proteome, and that has characterized about 3,000 differentially expressed proteins as well as peptides. So the saliva also helps for the screening of respiratory viruses without any pyrexia or respiratory symptoms. And recently it is found that saliva helps in the detection of SARS coronavirus infection. So for the study to carry out, the proteome of the saliva from 3 groups of patients was investigated. This study was carried out by the Catholic University in Italy in the year 2017. Among the 3 groups, first group included the healthy control people, and second group the individuals with potential malignant disorders, and the third group with oral squamous cell carcinoma. And the investigation was carried out by using SDS page, that is polyacrylamide gel electrophoresis. And from the study, it was found that thrombospondin 2 as a potential biomarker. It was found as a potential biomarker because it was associated with overall pathological state of the diseases. And not only this, many other studies were carried out, which include nano liquid chromatography coupled with mass spectroscopy techniques, which was further validated by Western blotting and ELISA. From that study, it was identified that S100A8 as a potential biomarker of oral squamous cell carcinoma. And two-dimensional electrophoretic analysis of the whole saliva of human was carried out. And from that study, it was identified that alpha-1 antitrypsin, heptoglobin beta chains, complement C3, hemopexin, etc. as the potential biomarkers. And the study was validated by ELISA. And the recent researchers found that not only for the oral cancers, the saliva can be used for as the potential biomarker in other cancer types. For example, breast cancer, gastric cancer, etc. And many proteomic studies in the past have already said that it can be used in many autoimmune diseases like systemic sclerosis, lupus erythematosus, rheumatoid arthritis, etc. And the proteomics of saliva also contribute to the detection of early markers of psychiatric diseases and the genetic disorders like Down syndrome, Wilson's disease, etc. And we know that we are passing through the COVID pandemic. Certain difficulties are faced by us in the diagnosis of the same. And the difficulties include for the diagnosis, we need a close contact between the healthcare workers and the patients may feel discomfort during the collection of the specimen and may cause bleeding in case of patients with conditions such as thrombocytopenia, etc. In such cases, saliva specimens can be used by those persons for whom the oropharyngeal specimen or the nasopharyngeal specimen collection is contraindicated. So the need of the healthcare professionals for the collection of the same will be eliminated. And the other advantages of using saliva is that it is very easy to collect as well as store. And it contains good quality DNA compared to other biological fluids. And it can be used as a better alternative for blood. And it can be given by the patients without any invasive procedures. So by this, we conclude from the review that in the future, saliva will be a relevant diagnostic fluid. And by the application of the recent technologies, it provides information regarding the health or disease state transition in each individual. I hope you all understood regarding the topic. Thank you.
Sir, you can proceed for the question actually. Balu sir and Shanmuratam sir.
So it is salivary apart from other protein, apart from salivary amylase. You are talking about other proteoma, isn't it? Huh?
Yes, sir.
Other proteoma. So how you said that this study was conducted in 2017 something, right?
Yes, sir.
That is if these proteins, if you are isolated, how can it won't cause any hypersensitivity reactions? Yet you told that it is used for some autosomal disease also.
Yes, sir. The results that was carried out suggest that no hypersensitivity reactions are so far established, sir.
But is there any study it is going on about against the SARS-CoV virus?
Not, sir. The studies are going on, and a study was.
This is an assumption. This is an assumption we can use as a biomarker
but
to treat
a comparison study was carried out recently, a few months ago, that the nasopharyngeal specimen results were compared with this salivary results, and both the results were same. So there is no recent establishment, but the assumptions are going on, sir.
Thank you. Sir, Shanmuratam sir, if you have any questions?
Yeah, no, you can move.
Okay. Thank you so much, Sandhya madam, for your presentation.
Thank you, sir.
I think in any other presentees which are left the presentations, please, if you have, you can just intimate me. Otherwise, we are going to conclude the session.
7.
Any other presentees?
7. Posted on the screen.
Okay, thank you. Thank you, sir. Thank you, Dr. Balasubramanian, sir. And thank you, Shanmuratam, sir, for your patience being there for at least more than 2 hours with us, and for your poster presentation evaluation, for your comments and for your suggestions, valuable suggestion for the improvement of their research as well as the review. Thank you so much for the Dr. Shanmuratam, sir. And thank you so much, Dr. Balasubramanian, sir. Thank you so much in behalf of Dr. Sydus Publishing and as well as Kalinga Biomedical Research and Training Establishment, Odisha. We are very much thankful to you for your presence and your valuable session. Thank you so much.
Yeah, thank you for your support. Thank you.
Thank you.
Thank you.
Thank you, sir. Thank you. So thank you for all the participants, those who are here with us from morning to now, around 3 o'clock now. Thank you so much for your presence and patience being with us for the whole session. Thank you so much. We'll see you tomorrow. Thank you.